Good morning, everyone, and welcome to the broadcast. This is a very exciting broadcast for us because this is the first time that the British Spiritist Medical Association has really taken part in this broadcast, and it's in the process of being founded at the moment. We've got as far as trying to get our name cleared. We also are sending in a request to the Charity Commission. So we'll be a charity, and that means that all of you can give us loads and loads of money, and that will help us go very well. So let me introduce Elsa, who is who who works with BUS, which is the British Union of Societies.
Elsa, you are on mute.
British Union of Spiritist Societies, dear Peter.
Oh, thank you. And Elsa has been enormously helpful to us in helping us create the British Spiritist Medical Association right from its beginning. And incidentally, some of you may hear a faint meowing in the background. That is Casper. Casper, our Burmese cat, and he loves coming to all these conferences and making his presence known. So if you're lucky enough, he may even show himself. So Elsa, welcome. And let us start from you with a simple act of gratitude.
Thank you, Peter. So welcome, dear friends, to our 8th British Congress on Medicine and Spirituality, starting in 2003. And we are very pleased to have all these beautiful speakers today, and starting with Dr. Peter Fenwick. And our gratitude means that we are so grateful for everything we are receiving in our lives. The moments that we are having now is a bless for each one of us. So we should say from the bottom of our hearts, thank you, dear Almighty Father, the divinity that guides us, giving us life, existence. And we are really happy to be part of this world right now, in this combination of sorrow and happiness. And we are together, brothers and sisters, working for a better world. So may your blessing be with all the speakers during the day, the ones that are watching from their homes in different countries. Good morning, good afternoon, good evening, and everyone will be blessed as well, linking thoughts with us. Bless as well the ones that are working in the backstage, working hard to prepare this beautiful Congress. And thank you for Dr. Marlene Nobre starting this process in the world. Thank you, Chico Xavier, Allan Kardec, and all the benefactors that are surrounding the medicine and spirituality. So with your permission, dear benefactors, we start our Congress right now. Thank you. Thank you, Peter.
Well, what's the program for the Congress is we'll have a number of talks this morning. Then at 12 o'clock, we'll have our lunch break. Then there'll be more talks in the afternoon, and we'll finish at 5 o'clock. So the first thing is Dr. Sonia Doi. As she, in fact, is the current chair of the position of president of the Allan Kardec Spiritist Society of Maryland, US, Spiritist Medical Association, and of the International Spiritist Medical Association. She graduated in medicine at the University of São Paulo, Brazil, and she specialized in endocrinology. Now, she very kindly has sent us a video to welcome you all and us to this Congress. So let's hear from Sonia.
Good morning to all of you who have joined us for the 8th British Congress on Medicine and Spirituality. On behalf of the International Spiritist Medical Association, I would like to thank all the organizers of this event for giving us time to present something about the International Spiritist Medical Association and the Spiritist Medical Associations in general. So the International Spiritist Medical Association was founded by our beloved Dr. Marlene Nobre, who probably some of you have met. Dr. Marlene Nobre was the founder of the Spiritist Medical Association of São Paulo, Brazil, which was the first organization being founded, and this was in 1968. Later, in 1995, she founded the Brazilian Spiritist Medical Association, and then in 1999, she founded the International Spiritist Medical Association. So you see that she was devoted to the cause of Spiritist medical associations, and she devoted a great part of her life to this cause, promoting new organizations, helping in the formation of new organizations, helping to spread the word on spirituality in the practice of medicine. When Dr. Marlene Nobre founded the International Spiritist Medical Association, there were with her representatives of 6 countries, physicians from Argentina, Brazil, Colombia, Guatemala, Panama, and Portugal. At that time, as you have seen before, the Brazilian organization had already been founded. Of these 6 representatives, 5 of them became officially affiliated to the international organization. Argentina, Brazil, Colombia, Panama, and Portugal, who are affiliates to date. Dr. Marlene Nobre led the organization until her passing in 2015. By then, 2 additional organizations had joined, Switzerland and the United States. So we're counting 7 organizations to that time. Now, I'm very happy to announce that we have new affiliates. We have the British Spiritist Medical Association that has been formed and is ready to join us, and is led by Dr. Peter Fenwick, Dr. Natalie Tolbert, Dr. Natalia Kotlярov, and Andre Davantel. Also in preparation to join is the Spiritist Medical Association of Uruguay, which is being led by Dr. Perurena. I forgot to say, and I apologize for that, there's another association who is already affiliated to the International SMA, which is France. France has joined us about 3 years ago and is being very active. The Spiritist Medical Association, in Portuguese, is Associação Médico Espírita, and in Brazil, it's known by the acronym AME, pronounced AME, which means, in Portuguese, love. And love is the core of our mission. So this acronym is very appropriate, but unfortunately, it does not translate as an acronym when we say it in English. So, but what is a Spiritist Medical Association? It's an organization led by physicians with the main purpose of bridging medicine and spirituality. Our main target is the healthcare professional who delivers medical care to our brothers and sisters, to our parents, to our kids, to ourselves. So The healthcare professionals are the providers, but the beneficiary are the patients. To them is what we dedicated our work. Don't we want a professional who treats us with compassion, who gives us the attention to both our needs, the emotional and the physical, who understands and respects our beliefs, and who is present when we most need? That's the professional, is the healthcare, the doctors, the professionals that we really would like to have. And I know that majority of the physicians, the healthcare professionals already work with those tenets that already work in this way, giving attention, compassion, and tending to the emotional and physical needs at the same time, who understand and respect the beliefs of their patients. But we want to bring this to more and more and more healthcare professionals, so that one day this is going to be a norm for everyone. So that's what spirituality in healthcare entails. It's not only to ask, what is your religion, what is your beliefs, but also to follow on that and help the patients in that way. So how do we work as an association? We work by promoting conferences, publishing articles and videos that shed light on the spiritual nature of the human being, to share knowledge about the connection between mind and health status, to share research data on the beneficial effect of spiritual care and spiritual practices. And these are very important because there's a lot of data there. There's a lot of research that have already been done on spirituality, on the benefits of spirituality in healthcare. Spirituality helping us to recover better, to heal. And not all physicians in different types of specialty have access or have been interested in that area. But sometimes when we bring a video, when we bring a conference, then they get awareness, they get broader knowledge on that. So why, this is a question that I get many times, why are Spiritist medical associations led by Spiritist physicians? Well, first, because it's founded by Spiritist physicians. But Spiritism, Spiritists, because the concept of Spiritism help in understanding the interaction between the troubles of the mind and what goes on, what is manifested as a disease, as an illness in the physical body. It also helps in understanding that the illness that afflicts us today may reflect our own experiences from a previous life. And it helps in understanding that faith ultimately leads to healing the soul. So we can cure a disease, but if we don't heal the patient, the disease may come back and may come back even worse. So it's important that as a physician, as a healthcare provider, we have this concept that we need to care for the physical body, but we also need to tend to what's going on in the soul, what is going on in the mind, the emotional part of the patient. It's very, very important that we work in both ways, and we work to promote an integrative care that takes care of mind and physical body. So why is this an association that is led by physicians? Because a medical doctor knows how the human body works, knows how to interpret symptoms and signs of an unhealthy condition, and most importantly, knows how to communicate with other professionals, other colleagues of the healthcare professional in technical terms. So it is easier to relate to colleagues in technical terms, and then it's easier to bring the concepts of Spiritism, the concepts that a human being has a spiritual nature, that we have many lives, and that experiences from past life may be affecting the present life. And all of this is very important to take care of our patient in a very integrative approach. Who can be part of the board? President and vice presidents usually are physicians, but other members of the board may be some healthcare professionals or other professions. So sometimes it's much easier to have somebody who understands better the finance world to be finance director of our associations. Who can become a member? This is pretty much in the context of each association. So regional associations, national associations, they have membership, individual memberships, and they also have other associations that are affiliated. So for example, in a national association in Brazil, there are so many associations, and the Brazilian Spiritist Medical Association has number of affiliates from all different states. And sometimes in the same city, there are several associations too. The International Association is a little different. It's only offers membership to national associations. So our affiliates are representative of different countries. So I hope that I have shared with you some information of how the Spiritist Medical Associations work. But if you have any question, if you want to talk to us, there's our email there, sma.int2020@gmail.com, that you can, of course, get in touch with us, ask your questions. Our website, we have a new website under construction, so we don't have it yet with full information there, but we already have one that we had an announcement from our Congress last year, and there are several videos from the last Congress in there. So you can visit that and have more information. And of course, as an international organization, we are here to support our affiliates. We are here to inspire new affiliates. And to that, I would like to end wishing the best for this Congress, which, of course, it's going to be a success, given the fantastic body of speakers that have been selected. And I wish the best for our newest affiliate, the British Spiritist Medical Association. And may Dr. Marlene Nobre, who is in the spiritual realm now, be always with us and help us to move forward with this mission that we have. Thank you all.
Thank you very much indeed, Sonia. That was a great talk. And what was so important is stressing the place that spiritual medicine has in medicine overall, because the changes which are occurring now in medical science are pointing to a much wider understanding of the nature of the human person and what mind is. And it's no longer just secreted by the brain, or it is in some circles, but not in the ones that I move. So before we go on, I will ask if we can have a little music, and then I'll start with my presentation.
Great. From Germany.
Edelweiss, every morning you greet me, small and white, clean and bright, you look happy to meet me. Blossom of snow, may you bloom and grow, bloom and grow forever. Edelweiss, Edelweiss, bless my homeland forever. Small and white, clean and bright, you look happy to meet me. Blossom of snow, may you bloom and grow, bloom and grow forever. Edelweiss, Edelweiss, bless my homeland forever.
Thank
Wonderful.
you. Thank you, Mauricio. That was absolutely magnificent. And Mauricio is a baritone, and he sings at the Opera Werkstatt on the Rhine. And he also sings in other places in Germany. So you've got a lovely voice. Thank you. It's a wonderful way to start the Congress. Elsa, anything you'd like to add before we go on?
We also thanks God for everything, Peter. It's a really a beautiful event. And now I think I will present you to be the next speaker. Okay. As you may know, Dr. Peter Fenwick is working and giving his time to the congresses since 2003, as he is the best friend from Dr. Marlene Nobre in the international area of BSMA, UK. So Dr. Peter Fenwick is emeritus consultant in charge of the neuropsychiatry and epilepsy unit at Maudsley Hospital and has published over 250 scientific papers. Oh my God. He is emeritus co-director of research at the Department of Neurophysiology, Broadmoor Hospital, and emeritus consultant neuropsychiatrist at the London Sleep Center, where he runs a clinical and forensic practice. He has studied magnetic field tomography of the brain at the Riken Neuroscience Institute, Japan. In the UK, he is researching near-death experiences in coronary care units and surviving approaching death experiences in hospices, in nursing homes in southern England. Dr. Fenwick is the chairperson of the British Spiritist Medical Association, UK Association. So people, welcome Dr. Peter Fennick right now and listen his beautiful talk, research. Thank you. Thank you, Peter. Over to you.
Thank you very much, Elsa. Thank you. Let me just get my slides up for you. And if I do that, I think you'll see the whole screen. Is that okay? Can you all see that?
Yes.
Good. Well, thank you. And thank you for asking me to talk at this conference. I see it as enormously important. You see, our whole idea of reductionist science is now open for investigation. And it seems to be breaking down in certain points. The main point is that we don't know or understand from a scientific point of view what consciousness is. Now, that is a huge lack. There are two views, one that it's just the neurons of the brain, and the other that it's outside the brain, and the brain acts as a filter. This was first of all suggested in America at the turn of the century. So the filter theory of consciousness, I think, probably is going to turn out to be the right one. Now, that means then that if one includes a much wider remit than we have been doing.
Dr. Peter?
Yes.
Can you turn on your camera? Can you click your camera on, please? We can't see you.
You can't see me. Okay.
On your camera, please.
Okay, let me do this. Because I think my camera is on. No, it's off. There. Is that better?
Yes. Thank you. Thank you.
Okay, thank you. Let's try again then.
Yeah. Until 11 o'clock. Yes. Thank you.
There we are. So the important thing then is the relationship to medicine and to consciousness. And that means that we, in fact, have whole mind medicine now, not just whole body medicine. So in this talk, I'm going to talk about prayer, distant healing, miracles, therapeutic touch, religion, positive thinking, traumatic grief, forgiveness, meditation, and spiritual healing. I'll only do a little bit on each subject just to give you a feeling for how things are. So let's remember that spiritual medicine is the relationship between spirituality and health. When I was at medical school, we were never taught about spirituality and health, but it's certainly now coming into the medical school, because spiritual components must be considered in both physical and mental illnesses. Spiritual medicine must be seen as a dimension of healing. Highest order healing processes of the individual are expressed, leading to healing. So it's the highest order holistic process. That's what medicine is now. And there's a growing recognition that organ-based medicine is very limiting. I mean, we're not just livers or hearts or brains. We are, in fact, whole people. And so mind-body medicine is important. Psychological experience, emotional states, pathological styles of behavior all lead to physical illness. And that's very important to remember. So the genesis of illness, in fact, in many cases, comes from the mind. And psychoneuroimmunology shows how mental states link to physical illness. Fortunately, the demand for spiritual medical courses is going up all the time. In 2008, 59% of UK medical schools had courses. That's only just over half, and that's not all that long ago. It's only 2008. The USA was slightly better because by 2011, 90% of US medical schools had courses. And I have two grandsons who are doing medical courses, and there is a lot more mind-body medicine than there used to be. And of course, spiritual medicine is now central to palliative care, as we're beginning to understand what dying actually means and what the processes are. And I don't have to say this, but compassionate medicine is now recognized as an essential building block of the medical process. Very important. Now, is there any reason, or certainly any reason in physics, as to why we should think beyond the body? And the answer is yes. It goes right back to the 1920s when quantum mechanics was first thought of. The aspect experiment shows that entangled particles stretch across the universe. In other words, we are interconnected with the whole universe, and mind may be able to function at a distance. And if that's correct, then the evidence for telepathy, clairaudience, clairvoyance, and psychokinesis is very strong. So if you're a current doctor coming into medicine, you can't just look at body medicine. You can't only look at mind-body medicine. You've got to look at the whole person and what the person actually is. So we are now coming into a phase when the mind can be expanded. Do you all remember that, I suppose it was only 20 years ago, we were thinking that if you wanted to become enlightened, and enlightened was then saying become much more aware of the universe, you'd go up into the Himalayas, and there you'd sit in a cave for most of your life, and then enlightenment would dawn. It's not like that anymore. It isn't as rare as it was thought to be, and it can now be learnt on courses. And this is Jeffrey Martin's course from California. It's a very good course. 70% of his students succeed. Now, this is all validated by questionnaire studies, etc. And we're beginning to understand what enlightenment means. You go through several stages of it, but this is just getting your foot on the ladder. And it's a transformation from subject-object thinking to non-dual thinking. So what does that mean? Subject-object is I'm looking out and seeing an objective world. Non-dual thinking, there is only one thing. The world and me are one thing. So there's a dissolution of the ego structures. And of course, it is an entrance into the very, very wide mystical experiences that we have. So there's a good book by Jeffrey Martin called The Finders, and that would certainly be worth getting hold of if you're interested. Now let's look at some of the ways that medicine has changed. Therapeutic touch. Do you remember we were told that we should never ever touch our patients? Well, of course you do. I mean, if you have an ill child, what you do? You go and sit on the bed, don't you? And therapeutic touch is a type of healing in which verified scientific mechanisms are involved. but transpersonal concepts are used. And so it isn't just the touch itself, it's the setting in which it occurs. There's a nice paper by Piszczewski in 2007, and they used a whole armament of mind mechanisms with group discussions, meditation, and diet in the treatment of heart disease, and it works very well. Now, the next thing I'd like to talk about is religion, and Koenig's book in 1991, Handbook of Religion and Health, is a very good place to start. What he showed is that religious factors are involved in the susceptibility to disease. And there are a number of reasons for this. Firstly, that most religious faiths limit self-damaging behaviors, encourage you not to smoke, take drugs, or drink alcohol, or certainly not to excess, which is the point, of course. And you also get a lot of support from attendance at church. And attendance at church, as I will show in a moment, in fact, makes you live longer. A stronger faith, positive relationships, positive thinking, all upregulate the immune system. So that reduces your risk of cancer, protects the cardiovascular system, and improves health. Social support is very important as it's correlated with changes in immune system functioning. And from social support, you of course get positive thinking. There are frontal lobe centers which carry the information about individual spatial functioning and mood states. And this is very important because they feed into the hypothalamus, the pituitary gland, onto the immune system, and to the secretion of cortisol. What we've all learned now is that high levels of cortisol correlate with both depression and anxiety. So positive thinking is a treatment for depression and anxiety. Is it better than medication? Probably, because it will certainly keep you healthy. What about the opposite, traumatic grief? That's very difficult, because there's a lot of evidence that traumatic grief, in fact, affects you in a very negative way. The death of a partner and high traumatic grief scores led to new cancers at 6 months and 15 months after the spouse's death. They had a large series of people whose spouses had died. This is Prigerson in 1997. Showing that traumatic grief scores led to new cancers. So that's something we ought to be able to do in our society. And of course, the Spiritist movement is one way it can be done and can help. High levels of hopelessness increase risk of heart disease and cancer and subsequent death. Again, we shouldn't be having people in our communities who are hopeless, because that leads to further illness. And the last one I don't like, because anger alters blood pressure and immune system functioning in marital relationships. And this is Keelcott-Glazer's study of married couples, showing that those married couples that were angry right at the beginning of their marriage had a change in their physical health due to the difficulties of the marriage. But the opposite is also true. There are positive effects of religious attitudes and spiritual attitudes. Regular church going is greater than a third reduction in deaths during a 28-year follow-up. That's very good. So a third reduction in deaths during a 28-year follow-up. 35-year study of 268 men showed that men with good psychological health and academic success and optimism were healthier than those who were pessimistic. Now, this is a fascinating study because it builds on the Harvard group of patients who've been studied over a number of years. And so good psychological health, academic success, and optimism were healthier than those who were pessimistic. And cardiac health markers increase with reduced blood pressure and inflammatory markers significantly reduced in those who were more religious and spiritual. And that's a very modern paper showing that it actually is important to have a religion or a spiritual side to your nature. What about forgiveness? That's very important. What is forgiveness? It's ceasing to feel anxious or resentful towards those who have hurt you. And there are special brain areas in the left frontal cortex which make empathy judgments. Nice paper by Newberg there. The middle temporal gyrus is activated when imagining a known person's response, and the cingulus gyrus is involved making forgivability judgments. What's a forgivability judgment? For example, if somebody steals milk from a supermarket, well, you're not terribly involved, so it's easy to forgive them. On the other hand, if they steal it off your doorstep, then that's quite a different matter. And this is what comes out in Farrow's paper. And of course, there is forgiveness therapy, and this is so important. It teaches people to think more positive thoughts, and there's some nice papers on that. Now, mindfulness and meditation. In 1972, mindfulness was used by Kabat-Zinn in Massachusetts in a group of patients with anxiety states. In fact, I well remember his first papers, which he was giving in meetings at that time when I went across to America to some of the conferences. He had to be very careful because speaking about mindfulness at that time in just a pure reductionist medicine conference, you'd be seen as really outside the norm. But the interesting point about mindfulness, he found that it had a longer lasting effect than drugs. Now, you should say, well, okay, so less stress on the medical system, but it wasn't that. This led to insurance companies funding mindfulness meditation, and that's now spread worldwide. Mindfulness is a recognized treatment for anxiety states and depressive states. Now, meditation. I can't even attempt a summary of the meditation literature. For those of you who want, do notice the reference by Shen, Chen, and Cui in 2020. It's very modern, which refers a large body of literature showing the effect that meditation has. It's astonishing. It shows the different brain areas involved in different meditations. So the brain and brain volumes all change. And note this one particularly, that meditation repairs the telomeres and lengthens life. The telomeres, if you remember, are the caps on the end of the chromosomes. And with each cell division, they get degraded until finally the cell can't divide anymore. And so it's related to the length of cells, the length of life by cells being kept dividing. Nice papers on that. And then don't forget this, that increased thickness of cortical areas where there is massive amounts of information, improved brain function, emotional regulation, and it improves attention and cognition. So meditation is now a central behavioral method of improving health. And I'm sure everyone in the audience, in fact, is a meditator. And I was particularly struck by the super radiance effect. The studies relate to TM meditation. And there's a very large study, which is actually a compilation by Jeremy Old in 2017. And he showed very convincingly that a group of trained TM meditators could have a positive impact on, and this is in the area which they are, the socio-economic trends. There's a reduction in crime, socio-economic trends, people don't steal as many bicycles, etc. Crime, terrorism, and war. And I would certainly recommend that paper for you, because it's quite clear now that what we really should have are groups of meditators in every community. Now, spiritual healing, does it occur? Yes, it does. And there are some papers, actually there are a lot of papers on this. Dan Benall published a book which showed over 500 healing studies. 191 were controlled studies, and of these 191 controlled studies, 124 demonstrated a significant effect. So there you are. Spiritual healing has to be one of the things that we take account of. People have broadened this out, and there are beginnings of a number of papers on shamanic healing, and there's one which I put in here of temporomandibular joint pain, and that suggested that shamanic healing could help it. And we're coming into another group. It's the power of storytelling and healing. We tell ourselves stories all the time, and in fact, some people would feel that our reductionist medicine story is a story which needs to be changed. It's very powerful at the moment. If you try and put a grant application in using reductionist medicine, it's much less chance of getting funded than one which uses the sort of techniques that we're talking about. So storytelling and healing is important, and there's a reference for you. Now, the role of the shaman or doctor in storytelling and healing is really just taking this into a wider social network. Prayer, of course, widely practiced in America. 64% of Americans pray every day, and 10% did so several times a week as well. So that's about 3/4 of Americans pray. The literature on prayer has become a bit confused. Coronary care patients, this was one of the first ones by Bird and his co-workers, and it was a double-blind study. They half the people, or a number of people in the coronary care group were prayed for, and Bird was able to show that there was a marked reduction in a number of symptoms in those who had been prayed for. But there are points against prayer. The first one is that God may not comply with a random controlled trial. I mean, you can't get away from that, really. But maybe it's not looking at prayer the right way. It's an interlinking between two people. People are prayed for all the time is another concept. So that may weaken, you may feel what you're doing. And the other thing is that prayer is not a unitary concept. There just isn't one prayer. There are many different forms of praying. And the mental state of those praying is important. This is a sort of study, which is a little bit off the wall. It was published in the British Medical Journal. It was in their Christmas issue, which is when they do publish unusual papers. And it was a very large trial. About 1,000 cases with blood disorders were divided randomly into two groups. These are the notes of these patients that had been treated in hospital and, in fact, then went back into the community. Now, one set of notes was prayed for and the other was not. And the interesting thing is that the groups, in fact, did turn out to be different. The prayed for group had shorter admissions and were not so ill as the control group. And so it suggests that a flow of linear time seems to have been violated. It's an interesting study. And of course, there've been a lot of criticism of it. But nevertheless, it's the way that one can start to think more creatively. I want to tell you this one. When I came across it, I was really impressed. It's a stunning case. It's a blind girl with junior macular degeneration or Stargardt's disease. This is where the macula, remember the sensitive part of the eye, of the retina, starts to degenerate. And you get a loss of most central vision. And this occurred for her, firstly, in 1959. Her vision was lost to counting fingers. Counting fingers means you hold a hand up in front of them and they count how many fingers you're holding up. And in her other eye, it was seeing whether or not a hand was moving. So her vision was appalling. And in 1972, her husband put hands on her head and prayed to God to heal her. And this is what the blind girl said. What people need to understand is I was blind, totally blind, and attended the school for the blind. I read Braille, walked with a white cane. My husband prayed for me. Just like that, in a moment, after years of darkness, I could see perfectly. Astonishing, because you got the whole thing there set out before you. Her eyes also showed true physical deterioration, which improved. And the author, who's Romez et al. in very modern 2021, said that they went through, it's a very good paper because it's got a lot of references to hysterical dissociation, hysterical blindness, and so on. But this wasn't. This is real blindness, well described and attenuated. It's easier to test prayer mechanisms on biological systems. And there is a nice series of papers looking at the inhibition of seeds by salt solution. And so what you do is you take salt, put it into the solution, so the seeds won't generate so well. And then you pray for one group whilst you don't for the controls. And there was a focus, there was a clear positive result of a healing mechanism on the cells that were prayed for. That's the Spindrift papers in 1993, and a later group was published in 2003. So there is evidence for that. Miracles, of course, defined as an act of healing attributed to intervention of God without a clear physical mechanism. And you remember that, in fact, this was defined as without a clear physical mechanism that we haven't yet discovered. The long Christian history at Lourdes, some papers on that, and changes in the structure of brain in 84 healthy Roman Catholic women correlated with a belief in miracles and spiritual well-being. In other words, to believe in these things, you have to have a different brain. And who knows if you, in fact, set up different filters within the brain, which allows miracles to occur to you. Feelings of belief correlated positively with volumes of the temporoparietal junction and negatively with the medial frontal cortex. So this is suggesting that, in fact, there are differences in the size of the brain. This is the Christmas issue of the BMJ again, which I've talked about. Gardner asks if miracles happen now like they used to at the time of St. Cuthbert. He describes a man in Africa who fell off a roof. People gathered round the injured man who lay dying with a bleeding liver. They all gathered round and it was suggested that they pray. As they did so, the injured man returned to consciousness and started improving. So that's the Xmas issue of the BMJ. And yes, there was a nice story that I had. He wrote this story in his paper. When modern missionaries left some gospel books behind in Ethiopia and returned many years later, they not only found a flourishing church, but a community of believers, among whom miracles like those mentioned in the New Testament happened every day, because there had been no missionaries to teach that such things were not to be taken literally. And remember, this goes back to our storytelling again. So there is a definite need for spirituality in reductionist medical science. So thank you very much for your attention. Well, there we are. I hope I'm back again. So let me now move on to introducing Dr. Tanya Stevanin. She had a PhD in microbiology, a graduate diploma in psychology. She's an international spiritualist lecturer. And Dr. Stevanin is the co-founder of the Sheffield Spiritualist Group in the UK, which is very exciting because they're beginning to spread. She'd been speaking in several events in the UK and abroad. So it's with a very great pleasure, Tanya, that we welcome you today.
Good morning, everyone. It is a great privilege to be invited to give this presentation. I'm sure you've been enjoying the morning session, and we are all going to enjoy the afternoon session as well. I hope that you will find my presentation useful. It's going to be a very personal presentation. I'm going to tap into my own personal knowledge and experience of being a spiritist person and also a mental health worker, and how to bring those two together. So you might ask, how does my spiritist knowledge and faith inform my practice? I believe that life does not start with the physical body and it doesn't end with the physical body. I believe that we are given many opportunities of learning, the same way that we go to school and we don't have to learn everything in one day or in 1 year. We are given the opportunity to go back and try again if necessary. So we in our lives. And first of all, I think the main thing that Spiritism gives me is I'm not afraid of being who I am. Spiritism gives us that strength, that moral strength to be who we are. And I never hid my faith from anyone, including my employers and even my patients. But the big important caveat is that Spiritism also encourages us to be respectful of others, and especially of other people's faith. So that is a priority for me. So being a spiritist makes me the person I am, to behave the way I do, to think the way I do. And a big part of it is to respect my clients, my patients, for who they are, good and bad, and not to try and impose my faith, my beliefs upon them. It's all about free will, but also understanding that we can better exercise our free will and our choices if we have enough information about what we are choosing and what the consequences are. And that is a big part of Spiritism as well, the freedom to choose, but the necessity to inform ourselves. In that respect, I would just explain briefly what for Spiritism is the human complex. There is a lot more information that you can find elsewhere, and this is going to be mentioned in other presentations as well, so I'll just mention it briefly. So the Spiritism sees humans as a trilogy in a way: body, perispirit, and spirit. The body being the physical part of us, the neurosystem, bones, skin, hair. And the perispirit is the fluidic envelope that acts as the intermediary between the spirit and the body. It's also where the memory and records of previous lives is located, so that sometimes that resurfaces. The spirit is the thinking part of us, where the mind is located, and the real us. Now, the perispirit is the blueprint for the formation of the biological body. So if during our previous existences we have created problems, disturbances that have become imprinted in the perispirit, it will reflect in the physical body. It's composed of particles identical to those that compose the physical body, but vibrating at a different level, at higher frequencies. So we can use the analogy of water. Water has three main different states. The lower vibrations is the solid, the highest is the gaseous, and the intermediary is the water. So the perispirit may be composed of material particles, but it vibrates at a higher frequency, making it a good connector between the spirit and the physical body. And of course, its composition is strongly influenced by the mind here being the thoughts created by our spirit. So now we need to distinguish the mind from the brain. The brain is the physical part, the hardware in a way, and the mind is the software, where the software is generated. So the mind, the spirit being the programmer that programs the software that then is run through the brain. So if there is a problem with the hardware, by brain damage or genetic conditions, then our expression and understanding and reactions to the world around us is going to be dysfunctional. If there is a problem with the way we think and feel with the software, then our reactions is going to be disturbed as well. So if we fail to understand our patients as a complex but individual entity, then we fail them. If we only see our patients for the physical aspects, we are going to be missing quite a big part of who they are. If every mental disturbance is interpreted by us as a spiritual disturbance, as an obsession, then we also miss the point, because the problem is the close interaction between the spirit, the perispirit, and the body goes both ways. So long-term mental emotional disturbances can cause more permanent disturbances and blockages in the physical body as well, making it impossible to reverse a diseased process. So let's have a look at the thought. Thought originates in the spirit and not in the brain. So thought is part of the software, not the hardware. The hardware is the machine that we use to express our thoughts. And thought is consistent of material particles as well. They are much more subtle than even the perispirits, the one that composes the perispirit, but yet matter. We know that thought affects the composition of the physical body. It affects the way we respond to medication. The placebo effect is well known. When someone is taking something believing that it has the active component, even if it doesn't, if I feel that that's going to, if I believe that it's going to help me in a large number of people, it causes physical change to the biology of the body. And sometimes it works even better than the real medication, but taken by someone who doesn't believe that it will work for them or doesn't want to be cured. When perturbed, the mind creates very potent and detrimental, destructive energies that will affect our physical composition as well as our behavior. So negative thoughts have a very practical and physical impact in our brains that could lead not just to hormonal disturbances, causing things such as depression, for example, hallucinations, but it can even cause permanent damage that impacts on our behavior and our quality of life. According to Spiritism, all morbid processes are essentially mental processes. So how we think, how we feel will affect our physical constitution. And health is the soul in a state of perfect harmony. So we see people who are happy and carry terrible disabilities or terrible illnesses, because happiness and well-being, resilience, it doesn't belong to the physical body, it belongs to the mind, to the spirit. In that respect, I understand that someone who comes to me with a genetic disorder, their brains, their mind has been wired in a way that causes them to respond very between two extremes, like borderline personality disorder or bipolar disorder fits into that category. I know that from a physical perspective, this person will always face challenges that other people, the normal, average person, don't have to face. So my role as a mental health worker and as a spiritist, guided by my spiritist beliefs, is to help these people to come to terms with those challenges rather than fight them, and have hope in the future. If I can impact hope and faith in someone who came to me with none, that in itself is going to start creating some energies of health that can counterbalance, not completely perhaps, but help in their own biology, biochemistry, and help them to respond better to medication, to manage their moods a bit better. So looking into the future, as a spiritist, I'm never looking only on today and tomorrow or even next week. I'm always looking at the spiritual future of my patients. So if something can't be fixed in this life, my role then becomes to help them to accept it and look further than this life. Not using this vocabulary a lot of the times, but just helping them to feel that there is hope in their future, that their future is not doomed to be as hard as their present is. I think mentioning the aura is important here, because we attract what we are, because we radiate energies around us. Every time we think or feel something or behave in a certain way, we create this energetic field around us, which can be healthy or unhealthy, and we interact with each other's energetic fields. Like our scents can be mingled in a room, our spiritual scent can be mingled as well. So for example, someone comes in with a history of heavy drinking, being a horrible person to their friends, even a life of crime, and something makes me warm towards them feel kind towards them. And I don't know why, because their behavior is the opposite to what I believe should be. And then someone else comes in, well dressed, well spoken, well educated, and I just don't connect with that person. This is because we are communicating at the energetic level, and there is some affinity there that connects us in a positive or not so positive way. Now, being aware of it, my responsibility as a practitioner, as a health worker, is to pull my energies back and either become overindulgent to the lovable rogue or overly critical of the well-spoken person that I have difficulty with. And also to remember that they might be feeling similarly. They might be feeling some dissonance towards me. So I need to work even harder to be as kind and to irradiate as good as energy as possible, enveloping them in love, understand, kindness. And it is incredible how powerful those energies can be, those thought processes can be, because it really can make the difference between someone staying the course of treatment or walking out and never coming back again. So we attract what we are, and once those connections are made, it's not always possible to undo them. So someone who is a heavy drinker, for example, or a drug user, it's natural that they will look to spend more time with people who engage in the same things that they do, because they will support each other, they will be kind to each other, they will be forgiving of each other. So when that happens, it's the same as someone that struck a friendship with someone who's not good for them. I was having this conversation with some people I know recently, because they were saying, oh, that person is not a good company for my son or my daughter. I said, well, it goes both ways. If they are caught doing wrong together, why is it always us that thinks that someone else's children are not good for my children? Because they are together, they are interacting, they are doing the same things. So maybe there's a possibility that my children might not be good for that person's child. When this is the matter of personal responsibility, which Spiritism is very strong about. It's about empowerment. It empowers us to take personal responsibility for our choices without judgment. So I was having this conversation with one of my clients just this morning, the other morning, when I said to him, be careful not to judge yourself too harshly. Because when we're trying to make changes, very significant changes, we stumble from time to time. And we can become our worst enemy. And if we do, then we attract the people who reinforce that belief about ourselves, that reinforce that belief that we are good for nothing, that we don't deserve to be happy. So, and that can be physical incarnate friends or spiritual friends. And that's where things start getting complicated, because as you can see, the symptoms of mediumship are sleep disturbances, anxiety, phobias, hearing voices or seeing things that no one else can see or hear, substance misuse, sudden or gradual deterioration in behavior. So basically ticks every box of mental health disorders. So how can we tell the difference between mental health problems and spiritual problems? Often we can't. And if we can't, what do? We treat the patient or client as a complex but individual entity and prioritize their immediate needs. Our role as a therapist is not to judge or to diagnose someone, is to help them. Sometimes a diagnosis can be helpful, but even saying to someone, you have a diagnosis of borderline personality disorder or a spiritual obsession, doesn't help them to solve the problem. What they want is, this is what you experience, that's how you can manage it to stay safer, to be kinder to other people and to yourself, to improve your quality of life. That's our priority, whether it is a spiritual obsession or a genetic condition, our role is to try and identify ways for the person to manage their present so that their future can be better. So before jumping into conclusions into is this or that, trying to diagnose the problem, we need to consider other aspects as well. Is there a family history of mental health problems, for example? It could be that there is a genetic factor there. What are their belief systems? Do they believe in something else apart from this life? Because if they do, then we can have a more spiritual conversation with them and bring hope into their lives that other practitioners may not be so comfortable to bring or to have those conversations. Other physical health problems that might also interfere. If it's a well-established depression, then medication may be useful. Same for anxiety and ADHD and other health, mental health, physical health conditions, and personality trends. Because basically, we print in our bodies who we are, our personalities that have been developing through many incarnations. And those habits, they are not going to be fixed overnight. But knowing what my personality, the core personality trend is causing the problem may help to tweak it, to start rewriting that program. So I'll give you some examples of the same conversation being had with people of different backgrounds, and the names have been changed, but this history is, these are real patients. So Sarah was a woman of Christian faith with a diagnosis of borderline personality disorder and an eating disorder and binge drinking. And because she had faith, beliefs came into the conversation quite early on, because she said that one of her coping strategies was to go to church on a Sunday. So we talked about spirituality, we talked about the goodness of God, and she asked me to pray for her, and I was very comfortable. And even when we still have contact, I mentioned to her that I still think of her and I still pray for her, which gives her comfort. Now, Carol was a Muslim man who got arrested for drunk and disorderly. So here I knew that this person came from a culture for whom their religious beliefs was very important, and he could be feeling that he had let them down by drinking, because for them drinking is taboo. So my priority then was not to talk about God or how bad he was. It was more about asking him, are you a practicing Muslim? Because if he says yes, then I know that God's view of him would be more important, and I could use language that could help him to forgive himself, reminding him that God is forgiving, even if our families take longer for us to forgive us, and he needed to forgive himself as well. Now John, as an atheist with PTSD, post-traumatic stress disorder, I had to use a different vocabulary, but I still brought spirituality into our conversation. But I use the word mindfulness, I use the word positive universal energies, visualization to describe types of prayer, to self-healing techniques to help him to visualize himself protected within a bubble of positive energies. So as you can see, we can tweak the language to help our clients, but we need to respect the core beliefs. So it can be useful to identify how far the problem has gone, because sometimes it might have developed into physical symptoms that needs to be taken into consideration. And if someone has depression, for example, then antidepressants may be very useful. And I don't think we need to be, as a spiritist, we are very open, spiritism is very open to development, scientific development, and actually instructs us that if science changes, we change with it. We don't restrict the change, we don't resist the change to imprint the old beliefs. No, spiritism is an evolving faith that goes with time. So we always encourage people to seek other medical advice as well and comply with the treatments that are offered, always trying to modify and improve their mental attitude, which is going to be essential during treatment and long term as well. So mediumship is caused, mental health problems caused by mediumship are due to disturbed thought patterns that are then hijacked by others. And I like to change the word obsession by abuse, because an obsessing spirit is nothing but an abusive entity that sometimes connects with us in a friendly way but causes a lot of harm in the long term. Anything that lowers our mental, emotional energies can become a trigger to both mental health disorders as well as spiritual disturbances. So we need to bear in mind the core problem is low self-esteem, is trauma, is it an overinflated ego, and work with that in mind as well. So the initial stages, as most abusive relationships, it can look very protective and loving, and then it gradually develops in something more abusive. And mental health practitioners are very familiar with this kind of process, a friend that then moves in, that becomes a carer, that then are receiving benefits in the name of the person that they are supposed to be caring, using their money to buy their own drinks, bringing other friends over, feeding them other substances to maintain that control. And again, it doesn't matter, as far as I'm concerned, it doesn't matter if that abuse is being perpetrated by a physical person or a spiritual entity. The core aspect of the problem is the same. We need to strengthen the mind, the resilience of the individual. Of course, if it is an incarnate person, then that person can go to prison if they are committing a crime, and we will deal with it in the way that the law deals with it. We are going to make the report the same way, but we need to bear in mind that if we take a support system out of the picture, we need to be offering something else in place. And that goes for faith as well. If we take someone's faith away, let's make sure that we are replacing it with something better. So if someone is taking advantage of a patient, it doesn't matter whether it is an incarnate or a discarnate entity. We look at the priorities: the safety, harm reduction, support network, so to replace something that's negative with something more positive. And our conversations will represent that as well. The problem is sometimes, because if we don't look at the core factor that is causing that relationship, we miss the point, and we see abuse victims. That happens a lot when they end one relationship and then fall prey to another abusive relationship, because we need to work with the individual. And if it is a thought process that is defective because of past experiences that the person has, maybe even in a previous life, where they have done stuff to other people and they come with that guilt, then we need to identify that if possible, rather than blame someone else or what's happening, but not blaming the individual either. It's about helping that individual to realize and understand that they can change their future. They can't change their past, but their choices in the present can change the future, and become more self-aware. And I use mindfulness a lot for that, because mindfulness is a form of prayer and it's a form of self-healing, and uses neutral language that doesn't carry the negative charge of the religious language. So I can say prayer to someone of faith, but I can say meditation to someone that I don't know if they have a belief or religious belief or not, or if they have a faith. And that is the same. What the purpose here is to help that individual. And Spiritism gives me this flexibility, gives me this freedom that I did not feel I had with the religions I grew up with. So sometimes we find ourselves in a religious setting that restrains us in terms of what we can offer people. And Spiritism gives me complete freedom, because it puts the focus on the good I'm trying to do to help other people, rather than trying to sell my religious beliefs. So I find it very easy to change the language I use if I need to, without feeling guilty about it, because it's about the good that we need to do, rather than persuading people of our beliefs. So how do we break the cycle when we identify that vicious cycle of self-punishment, going from one abusive relationship to another, one obsession to another? We need to understand that we construct our own social reality. That is, we have free will, we have the freedom to choose, and it's our choices that will make the difference. Social influences shape our behavior, which means if I make choices that bring people who like drinking, abusing sex, misbehaving, committing crimes into my life, it's because if I enjoy those things as well, I might feel guilty, but I'm still enjoying it, because if I wasn't, I probably wouldn't be doing it. So if I start changing the choices I make, then I change gradually, inevitably, the people I hang out with, the people around me. And that's because our personal attitudes and predisposition also shape our behavior. So again, you can see that the science of psychology and spiritism, they're just using different words to say the same thing. It's about personal responsibility, it's about choice, it's about time. What spiritism gives me that other religions or science alone doesn't, is the gift of time, the gift to know that life doesn't start here and doesn't end here. Life continues. So the lessons I haven't been able to learn now, I can learn later on if I continue to make the effort. And that goes for my patients. So I never despair, I never lose hope. And the hope I have can be imparted on them as well. We have to be careful, because with our thoughts, and this is one thing that I always stress for my clients as well, make a plan, believe in something, visualize that future you want to have, visualize yourself succeeding, because we can create our own reality, we can create our future, and it starts with our present thought. So our situation will change according to how we change our perceptions of things as well. And I was having a conversation with another patient recently, and she started by saying, oh, it's going to be something negative, and I want to talk about it now because I want to talk about something positive later on. And then the way we talked about it, what did you learn from it? What was the positive about it? So problem-free talking about what can you get from this that will make your tomorrow better. And we ended up agreeing that instead of being a negative conversation, it was actually a very good positive conversation that made her feel better. The problem still exists, she still has some hard choices to make, but now she felt positive towards those choices, she felt empowered. So as the process sometimes continues, as I mentioned before, if we don't change the pattern, then it becomes more long-term, and it can impact on the physical body as well, to the point where certain changes can become permanent, but not forever. Permanent in this life, but not forever. So our thoughts determine our behavior determines the type of person we want to be. And our thoughts can act upon other people's thoughts as well. So if I tell people, go show your positive changes to your friends, inspire them as well. And we've got some good examples of that. Because by sharing our beliefs with other people, by even having that problem-free talk to somebody else, it becomes a catalyst to change in itself. And going back to the examples that I gave earlier, that conversation with Mary didn't change who she was. She's still fighting bulimia and her extreme mood swings, but she now knows that her belief system, praying, helps her. Carl also left the session feeling more motivated, and I haven't heard from him anymore. And John fed back to me that the meditation was helping him to cope with the PTSD, because he was learning gradually to create a safe place for himself, where when he had the flashbacks he could go into the safe room and ground himself and feel safer there, and that was helping him to cope. So each one of them benefited from that conversation, that more spiritual conversation. We have to also bear in mind that not everybody wants to feel comfortable with change, because change is difficult, change is uncomfortable sometimes, even good change. So as a spiritist, I don't rush people if they're not capable of that, because that would drive them away. But I don't feel bad about it, because I know that at some point, when it is the right time for them, they will get there. And that hope helps me to say to them, it's okay, you don't have to punish yourself even more because you're struggling. Keep going, keep believing, and you will find a way at some point. You will be able to do that. And that helps them. That in itself is very positive for them. So I think, spiritists or not, as mental health practitioners, we have a lot to learn from Spiritist teachings, because Spiritism gives us that extra, which if we just stay with the physical aspects of illness, a lot of things we can't understand and help. But if we expand our knowledge and understanding beyond the physical aspects, then there is a lot that we can do for our clients. If nothing else, at least helping them to forgive themselves, to be kind to themselves, to believe in themselves. And that goes for us as well. So thank you very much for listening, and I hope you continue to enjoy the other talks this afternoon as well. Bye. Treatments that are
Tanya, thank you so much for that. That was a really lovely presentation. There are going to be some questions for you. I'd like to ask one. You're a psychologist, and you've been trained as a psychologist. When you swap into your medium mode, how do you do it? And do you do it in front of the patient? Do you say, we're now going to sit quietly, or is it just something which comes to you? How do you do it?
it's that part of me. I see it as more for myself, as a complement of the theoretical knowledge about psychology, etc. So I would, for example, if I'm seeing someone, and I've had several cases where people have been diagnosed with schizophrenia, for example, but I know I've identified quite early on that it's the spiritual companions that are tormenting them, the visions, etc. So I prepare myself extra before the session. I might even pray in the room to create an environment that is conducive, and to try and protect that person, so that when I talk to them, I'm talking to them and not to the interfering entities. I never use that word with a patient, like mediumship or being a medium. I get a lot of intuition, but I don't open up too much, because I don't want interference. The inspiration from the benefactors, the spiritual guides, that comes naturally at the time of need. So trusting that makes me a good area to pick up that information without having to force that issue.
Thank you. That is a very nice answer. I just wanted to extend the question one more, then we'll go on to the ones on the screen. When I was in Sao Paulo, I went to a medium session and people were sitting in rows. And there was a medium at each end of the row, and they walked along and put their hands above people. When that had been done, there's a little talk, and then people went away. And of course, it was quite free. What's your view of using mediums that way?
I think it depends on the context. Within the clinical context, for example, unless the person is open to that kind of thing and introduces that desire to be part of something like that, I wouldn't necessarily open up to that. But what I do a lot as a medium, as a healer myself within spiritist centers, during this, I do like small, short mindfulness practices with people, and one of the ones that I do quite a lot is what I call the shower of light, where I take them through that shower of light, washing away the negativity, replacing it with positivity. And that time I'm also giving healing to the person, but I'm just not using those words, and I'm not putting them in a difficult position to either agree or disagree with my spiritual beliefs, because they can get the energy, the positive energy, whether they want to know more about spiritism or not. It doesn't matter. It's irrelevant. The purpose there is to help that individual.
Excellent. Thanks very much. That's a very nice answer. Now, we had the question for you, which was on the screen. There we are. Can mediumnity... Can the medium be hidden behind the manic psychosis? Interesting question. Mania and mediumship?
Mania and mediumship, absolutely. In fact, most mental health disorders are mixed. We could call them, there's a dual diagnosis there. There's always a spiritual aspect as well. In the same way, it goes for the positive side as well. When we talk about inspiration, I had this moment of inspiration, we know that often the inspiration comes from our benefactors that are either enhancing our own natural abilities or even using us as a channel to their thoughts and ideas, knowledge. So it often is the case. And it's about, my view is about treating the mind, the spirit, with positive influences, positive thoughts, positive action, but also treating the body if that has become disturbed as well. If there is hormonal imbalances, chemical imbalances, other illnesses that are affecting that process. So again, it's working in combination with traditional medicine, science, and other therapies.
Yes, I think that's important. For example, would you give somebody in the manic psychosis some of the antipsychotic drugs to calm them down? Or do you feel behavioral means or mediumistic treating is enough?
I think whenever possible, because those drugs are so strong, it impacts so heavily on that person's ability to be themselves a lot of the times. I am not against it. I don't prescribe myself, but I see a lot of people who are under this type of medication. When properly dosed, it's beneficial because it at least helps the person to cope with the more extreme presentations of their mental, spiritual illness. But that alone is not going to be a solution. So they need to change the way they think and feel and react to events around them as well. So that's when, if they are open to it, prayer, healing, meditation would be helpful.
Yes. Okay, thank you. Now we have another question. How to support someone who's struggling with mediumship and do not accept it? It's a nice question.
That goes for the majority of humanity. With kindness, we cannot force people to believe the way we believe. And if they don't believe, it can work it can make matters worse by driving them away from the help that they could be receiving. If they don't think that their mental emotional difficulties are at least compounded by external factors, external entities, then they are not going to want to hear us. It's the same way. I work with lots of people who are in abusive relationships in this world. They are married to them, they have children with them. And if they're not ready to move on, if they're not ready to disconnect themselves, telling them how bad that partner is going to drive them away. So the job is to encourage them to engage in more positive, healthier activities. So be careful with what on TV, pay attention to the music you listen to, the conversations you have, and start from those basic levels.
Yes, thank you for that. It raises another question. Alan Sanderson has done a lot of spirit release work in this country. And one of his lectures I went to, he was saying that sometimes if people are in very traumatic situations, a spirit may get into them and control their behavior. What's your view on that?
We have the key to the door. We leave the key on the door, on the lock, and sometimes we open the door. It goes both ways again. Just blame an external entity is the same as blaming another child or your partner for making you do bad things. At the end of the day, we have a choice. And sometimes the control that certain entities have even take over the physical body of that medium is quite extreme. And again, but if we just say, oh, it is because someone else is making you do those things, then we disempower that individual. We're telling them you have no choice, you have no control. And if you don't have control or choice, you don't have hope that things can get better, because you have to trust on somebody else to change, and that may not happen. So again, it starts from the beginning, starting from scratch and helping the person to gradually strengthen their willpower, become more aware of the choices they make, become more aware of when they have choices that they can themselves make, and patience a lot of the times from both sides, because these are long-term processes that may not have a resolution in this lifetime. So again, it's offering that person some hope that things will get better, and learning to enjoy and notice the good times, the moments when they are free from their interference, and learn again to enjoy those moments of freedom.
That's very helpful. Let me just take you to one more point, and that is that what Alan Sanderson does is people will lie on a bed and he relaxes them, and then he will talk to the spirit and ask it to come out. What's your view of that?
First of all, they don't come out of anything because they don't go into anything. The connection between spiritual entities and us is from perispirit to perispirit, from mind to mind. So they don't invade our physical body. We become puppets, like, the puppets that you move around, because the connections are there. So the second is that can be a very useful technique, because if you talk, now we don't have a mediumship group in Sheffield, but we did in the past, and I was the main counselor at the time. So that was my job, to talk to those entities and persuade them to move on, to be better. And the way I did that was not by telling them, you are a horrible creature, you deserve punishment, and this poor person, look what we are doing to this poor person, was to say, look, you are harming yourself by doing what you're doing. If you don't like this person, why don't you go and hang out with people you do like, with people who love you, who cares about you? So again, treating that entity as my patient at that time, and helping them to see that there was another alternative, that doing what they were doing harm to themselves as well as that other person. But
Yes,
it
that's
can be a
really
useful
interesting.
technique.
One of the things which Alan Sanderson used to do is to tell the spirit to go to the light. Would that be?
Yes, because the light represents goodness. Often in the light, the light is created by the friends and family that come to try and help them. So that is a very useful technique to use, opening up their minds, to taking them to what was the last time that you remember being with someone you loved? Who was that person? That in itself brings the light to them. And feel enveloped. I also say you're being enveloped by light, because sometimes they're blind, they can't see it, but I know they're being enveloped by light. So that is about telling the story, as you were saying earlier on. You start creating that mental picture that helps them to see what is there, but they were not seeing before.
Okay, thank you. Now there's another question for you. What advice would you give to spiritus health professionals that try to completely separate the two worlds, psychical and spiritual?
Good luck with that, because I don't think that is possible. You can't. We are body and spirit. We are living in a physical world, but completely intermingled with the spiritual dimension. I would say that respect and accept who you are. I think there is a misunderstanding sometimes that people think I'm a medium, so I have to always express my mediumship. That there are many different ways to express one's mediumship, and if that becomes a source of conflict in terms of trying to help someone else within our clinical practices, then rein in your mediumship and be more a human being, a kind, loving human being, respectful human being. That's more important. But it is not completely possible to separate the two. There is I think sometimes what people think is that if I come out as a spiritist or a medium in my workplace, I'm going to be ostracized. I'm going to be laughed at. I made the choice from the beginning. When I came to Sheffield, I came to do a PhD, and I told my supervisor, I need an afternoon off to go to London every week. And said, why? I said, because I work in a mediumship group, and I want to continue. Bang in the middle of the week. Yes, bang in the middle of the week. I'll make out the hours another time. And I had to work harder. But because I was honest and I was not afraid to be who I was, I didn't have to explain. He was not interested in what I did. The only thing he knew is that it was very important to me. And he respected that. This week I had to put in another form at work. I work for the NHS, and we are going back to late clinics, face-to-face clinics again. So they are changing the time, my working hours, and of course it's going to be on the day that we have our meetings. So first thing I did, I went into the website, I pulled in the procedures, I filled in the form, and I said, I need an hour, I need to leave an hour early on a Thursday because of my spiritist meeting. I used the words. And there is a lot more, as you said again, there is a lot more understanding and respect for people's beliefs. And if I find that if by being true to myself and honest, but not pushing, not forcing anyone to believe in the way I believe, I've always been respected. I never had any major issues. I'm not afraid or embarrassed of who I am and the faith I practice.
I think that's an amazing change which has happened, that now it can be tolerated. I can just see that when I was a young medical student, or even in my first year as a doctor, and I'd said that sort of thing, yep, that would have been it.
Yeah.
Okay, there's another question for you. How can we be aware, this is a good one, how can we be aware if there's an entity around us trying to influence us? apart from people, of course.
There's always entities around us trying to influence us. Some are trying to influence us to do good, to be good, to think good. Some are trying to influence us to be who we were once upon a time, but we are not anymore. Again, the choice is ours. Sometimes I notice, for example, there's something, I'm feeling down, I'm feeling anguished, depressed. And I have a little checklist in my head that I go through to find out whether there is something in my life, my personal life, that justifies that. Have I had any issues at work? Did I have a good night's sleep or not? If the checklist goes no, then I think, okay, there might be someone that is making me feel this way. So I say a prayer, I ask my benefactors for protection. Spiritism instructs us not to talk directly to the troubled spirits that might be around us, but ask our benefactors to help them, to do whatever they need. Outside the mediumship meeting context, we are not encouraged to talk directly to entities, but we can say prayers to them, we can envelop them with love. That's what we do. And if it becomes too disturbing, then we need to get others to help us. If we are in contact with a spiritist center, let the director, let our friends know that we are going through a difficult phase, ask for prayers. Even if we are not spiritists, we can always ask friends and family and say, I'm having some issues. Can you just keep an eye on me, be loving, let's do something fun to lift our mood and our spiritual energy.
And when you walk down the street, do you see spirits around people? Can you do that, or is that a special gift?
Yeah, I don't have that kind of mediumship. I don't hear or see spirits directly. Sometimes I get what I say, I see it in my head, kind of thing. It's more intuition than vision or than sight or hearing.
Yes. Okay. We had another question for you. First question is related to the possibility to adapt behaviorism principles as Divaldo. Pierre said to repel thoughts, but knowing mistakes from before are repaired through expiation pain. Oh, that's interesting. What do you make of that?
Spiritism says that we can learn through pain or through love. And whenever possible, we should choose love. So we choose goodness. The other aspect of this concept is, yes, as I mentioned in my presentation, if I have engaged in a certain problematic behavior for many lives, and then at some point I made the decision to change, I'm not going to change it overnight. It's not just making the decision to change that's going to change it. So God utilizes with us a system similar to exposure therapy to cure phobias. So God provides us with a string of opportunities to face events that would lead us to behave in the way we behaved before, but this time I'm choosing a different behavior, and sometimes we get it right and sometimes we get it wrong. But we know that when we get it wrong, God will provide us with another opportunity and gradually intensify those experiences until we pass the test and we've learned the lesson. We don't have to go through that anymore. But we don't have to do that through pain. Pain comes from our resistance to change, and we keep making the same mistakes. So I work with people with alcohol who drinks too much, and sometimes I have the conversation. I tell them, go sit in the waiting room for 15 minutes after we finish here and look at your future, or what your future could look like, especially if it's someone who comes in for the first time. Their liver is okay, the pancreas is okay, but I can see what's going to happen in a few years' time if they don't change. And I know that there will be people sitting in the waiting room who are there, whose liver is failing, whose pancreas is failing, they're shaking non-stop anymore. So I say, go and have a look. And then you decide what is that you want to do. You make the effort to change now, or risk being there in a few years' time. So we can use behavioral techniques to change our spiritual history, but it takes time.
Okay, that raises the next question, really, is do you see this planet as a planet where people come to be challenged and to grow in experience?
Absolutely. And I think just looking outside the window or turning the TV on 5 seconds of the news tells us that it is a planet. And I know that we use in Spiritism, we use the word, the term trials and tribulations, which I think it's a very negative take on what it is. I would say opportunities to change, because it is a world that offers us many experiences where we are challenged. But being challenged is not a negative thing, it's a positive thing. If you're being challenged, it means you already have some awareness that change can be achieved. And now you have the choice to choose better this time around.
Yes. It's interesting, really. Okay, well, that looks like it's the end of the questions. So let's just have a look and see what the time is. Oh, yes, it is indeed end of question time. So, Tanya, thank you so much for your presentation. And thank you very much indeed for being so open and so helpful with your own personal journey through mediumship and what you have been able to do with your patients. It's enormously helpful and edifying for us. So thank you very much indeed, and thank you for coming along.
Thank you.
Okay, bye-bye.
Bye.
Now then, we have arrived at midday, and there is going to be, as you can see, a lunch break from 12 to 2. That's a nice long lunch break for you all. And I think if any of you picked up anything that you want from my presentation, particularly in terms of references, then let me know, because I can let you have them. And there are 1 or 2 references which I think that you may actually like. So let's go now, and I'm going to introduce the musicians from our lunchtime concert. You've heard Mauricio at the beginning. He's a baritone that works in Germany. A fantastic voice, lovely voice. And then Moaz Camargo, sorry about the pronunciation there, who's a composer and singer, and works in musical TV shows. Anastasia McKenna from Brazil. Oh, that's nice. Hi. A singer in a soloist band performing in several national and international events. And Pablo Letho from Canada, a musician, singer, and composer. And then finally, Lucas De Paz has an academic degree in the Faculty of Fine Arts of Parana. He acts as a professional musician, a teacher, and a multi-instrumentalist. So I'm going to now hand you over, if she is here, to Natalie Talbot, who will take you on after the lunch break. Is Natalie here? Is she in the waiting room? It's a very nice system, this. If not, don't worry, because I will pick it up then at 2:00 when we come back and hand over to Natalie then. So, musicians and all the good things that you have for us, let's go. Pick it up then at 2:00 when we come back and hand over to Natalie then. So, musicians. I thought I saw Natalie arriving. Yes, there she is. There, it's like a mediumship.
Yes, there she is.
Hello, Peter. Hello, everybody. Be nice to.
Hello, Natalie.
Yes, there she is.
I've got a most terrible echo in mine.
Hello.
Ah, there we are. That's much better. Natalie, welcome. Natalie, as you will have seen from the program, is a medical anthropologist who specializes in social inclusion and education for medical schools, hospitals, and universities. She offers staff training on spiritual and cultural perspectives for understanding health. Natalie has undertaken original fieldwork in Sudan, India, and also in the UK with the NHS and King's Fund. And she's been very, very creative in the way that she uses her knowledge, her medical anthropology, to go into medical schools and try and broaden the students' minds. She's absolutely amazing. She's author of 4 books, including her latest teaching manual. And I hope that she'll tell us something about this. It's Cultural Perspectives on Mental Well-Being, Spiritual Interpretation of Symptoms in Medical Practice. So, Natalie, it's really very, very nice to have you on the show. And what the others don't know is that you've been helping very much with the BSMA. And so, thank you for all your help in this. And let me hand over to you now. And then later on, we can meet together at 2:00 when you take things further.
Yeah.
Okay, Natalie.
All right. Thank you.
Over to you.
Very much, Peter. And I've really enjoyed the morning and the questions and the talks. It's made it's so interesting to hear this perspective. Now, I'm going to hand over to Elsa, who'll introduce the musicians, and then I'll come back at 2:00 for the other speakers. So very nice to meet everybody. Thank you.
Que o amor eleva, viverás na terra sem tocar o chão. Ama, afugenta as dores, pensamentos, flores te envolverão.
Natureza e toda a beleza é fruto do amor. Ama, que o amor perdoa e o perdão te doa muito mais amor. Ama,
canção mais bela é a que revela as notas do amor. Ama, que o amor te espera nas altas esferas pra compartilhar. Ama, que o amor te inspira, faz o peito a lira. Livre a
God in you. God needs you. He is within you and you ignore him. He manifests his presence in your life in 1,000 ways, but you still ignore him. He nourishes you with hope. His radiating love sustains you and shows itself within your body, your mind, and your emotions. He is present in the air you breathe. His light, radiating from the sun, vitalizes your energies. His presence envelops you and shows itself through you. You must try to reach him consciously, changing and dignifying your moral and intellectual behavior so that you can share the benefits of his higher communion. From God you receive the inspiration which leads to spiritual growth, enhances your actions, and harmonizes your existence. Your thoughts, words, and actions must reveal the presence of God in you, for you are immersed in the ocean of his omniscience. Growing with God, you unfold and gain the boundless spaces of immortal life. Thus God needs you, so that you may reflect his light. On seeing him through you, all people must feel him and love him too. They will wish to strive to reflect him in themselves also. And by so doing, all may reach the fullness which one day shall fulfill every life.
Our bodies will disappear, not disappear into nothingness. They will break down and they will become other things in nature. But our energy goes to what we call the spiritual world. It's difficult to imagine how that is or where that is, but it is somewhere. It is an existence. We progress a certain amount each time we're here. So when we come into an incarnation to live on earth, we have an opportunity of learning. It's like a class, like a year at school. We learn a certain amount of things, but we don't learn everything, for sure. Some people live a few years and some people live 100 years. So that wouldn't be fair that some people get a long time to be here and others just a short time. So to imagine that we have a period of recovery or meditation or whatever, and then we come back to have another opportunity to carry on developing our understanding of the world. And that makes sense because if you look at people around the world, and even in your own family, sometimes there are people who can be quite young in terms of biological years, but they're so wise. Where has this wisdom come from? And other people who can be much older, but they can be quite like children still. So we can imagine that if we come back, and each time we come back, we have opportunity to learn and develop.
When I find myself in time of trouble, Mother Mary comes to me, speaking words of wisdom, let it be. And in my hour of darkness, she's standing right in front of me, speaking words of wisdom, let it be. Let it be, let it be, let it be, oh, let it be. Whisper words of wisdom, let it be. And when the broken-hearted people living in the world agree, there will be an answer, let it be. For though they may be parted, there is still a chance that they will see. There will be an answer, let it be. Let it be, let it be, let it be, oh, let it be. There will be an answer, let it be. Let it be, let it be, let it be, oh, let it be. Whisper words of wisdom, let it be. Let it be, let it be, let it be, yeah, let it be. Whisper words of wisdom, let it be. And when the night is cloudy, there is still a light that shines on me. Shine until tomorrow, let it be. Wake up to the sound of music, Mother Mary comes to me, speaking words of wisdom, let it be. Oh, let it be, let it be, let it be, oh, let it be. There'll be an answer, let it be.
your renewal. You can resume an edifying task at any time. It is never too late to begin again. On the other hand, it is harmful to let a noble action go unfinished. To stop an activity whose execution is beyond your strength is understandable, but just to leave it unfinished carelessly shows moral weakness. Life is full of challenges. You are constantly moving from one action to another on different ascending levels of moral and intellectual values. This is the reason we must always start over again. Things are happening all the time. Now, a disappointment seems to shatter your aspirations. A misfortune may seem a total disaster. A beloved one dies and leaves a void in your heart. An insidious disease breaks down your physical resistance. A vice may almost drive you to insanity. A financial loss apparently ruins all your economic security. An unexpected betrayal almost drives you to suicide. All such trying circumstances should steer you up to start over again and never to give up. Because without such unpleasant phenomena, there would be neither progress nor liberation from your present stage of spiritual development. So when you find yourself caught in the net of unforeseen circumstances or facing an unexpected problem, stop, calm down and meditate. Do not let yourself be dragged by tumult. Seek refuge in prayer and draw strength out of it. Everything goes. Your problem will also go away. And if you have gone through all such things, start your renewal cautiously at first, until you are again integrated in constructive actions. Your renewal is the first step towards the coming happiness.
Sei stille dem Herrn und warte auf ihn, der wird dir geben, was dein Herz wünscht. Sei stille dem Herrn und warte auf ihn, der wird dir geben, was dein Herz wünscht. Der wird dir geben, was dein Herz wünscht. Befiehl in deine Wege und hoffe auf ihn. Befiehl in deine Wege und hoffe auf ihn. Steh ab vom Zorn und lass den Grimm. Sei stille dem Herrn und warte auf ihn. Warte auf ihn, sei stille dem Herrn und warte auf ihn. Der wird dir geben, was dein Herz wünscht. Der wird dir geben, was dein Herz wünscht. Der wird dir geben, was dein Herz wünscht. Sei stille dem Herrn, sei stille dem Herrn und warte auf ihn.
The best way for us who lose someone through death is to send our love. And the way we send our love for many of us is to pray. I often like the idea of thinking of that person who has departed as like someone who traveled far from you. So let's pretend your child upon, let's say graduating from high school and before going to college, your child, maybe 18, 19, has a possibility of a great adventure, going far, far away, maybe backpacking in Europe in a train. And you still have a relationship with your child. You can call your child, right? You can send an email or text. You can stay connected even though you're not physically close to him or her. And you actually want your child to have a great experience. So the best way to really cultivate that relationship with those of us that have family members and dear friends who have deceased, have departed, is to think that you're actually writing a letter, writing an email, sending a text, talking on the phone. That person will receive your vibrations of love, your thoughts, your ideas, and your love as well. So it's a great way to understand that that relationship continues on.
Sonhar, mas sonho impossível. Lutar quando fácil ceder. Vencer o inimigo invencível. Negar quando a regra vender. Sofrer a tortura implacável. Romper a incabível prisão, voar no limite improvável, tocar o inacessível chão. É minha lei, é minha questão, virar esse mundo, gravar esse chão. Não me importa saber se é terrível demais. Quantas guerras terei que vencer por pouco de paz. E amanhã, se esse chão que beijei for meu leito e perdão, vou saber que valeu delirar e morrer de paixão. E assim, seja lá como for, vai ter fim na infinita aflição. E o mundo vai ver uma flor brotar do impossível.
Dear Lord, thank you so much. Thank you for everything that you've given us. Thank you for the bread we eat, for the air we breathe, for the happiness that we possess. Thank you so much for the eyes that we have and for all the beauty we can see in nature. Eyes that can see the sky, the earth and the sea. Eyes that can follow birds flying in the indigo sky. And that can rest at green fields splashed with flowers in thousands of colors. Thank you so much, Lord, because I can see those who I love. But my eyes also show me those who are blind. They walk around us in their darkness, stumbling in the crowds, sometimes crying in their loneliness. Let me pray for them and ask you to shine your light into their lives. Because I know, after this test, beyond death, they will see again. Thank you so much, Lord, for my ears. Ears that can hear the symphony of life. The drumming rain on the roofs. And the wind's melody through the fields. They also can hear the tears shed from eyes from all over the world. My ears hear people singing gladly as well. And they hear the unforgettable classics, immortal masterpieces. My ears hear the simple and warm voice of the cowboys and the painful cry of those who suffer. From the gladness of my ability to hear, I want to ask you, Lord, give strength and hope to the deaf, because I know after the pain of living in silence, in your loving kingdom, they will hear again. Thank you, Lord, for my voice, but also for your voice, in the voice that sings, that loves, the voice that educates and teaches, for the voice that hums a silly song, and for the voice that speaks of your love. Thank you, Lord. Because I'm so happy I can speak, I want to pray for you, Lord, in the name of those who suffer from aphasia. They cannot speak or sing. I pray for them, because I know, after this challenge in the new life, they will sing gladly. Thank you, Lord, for these hands that are mine, levers of action and progress. Thank you also for the hands that seed, busy hands that create and produce. I'm grateful for the gentle hands that comfort and give hope in times of sorrow and pain. Hands that hold other hands, showing solidarity and care. Hands that wave difficult goodbyes and dry out painful tears. For the hands that make music, poetry, surgeries, automatic writings, for the hands that assist the elderly, minimizing their pain and the lack of affection, for the hands that love and protect other people's children without any fear or reservation, and thank you for my feet that lead me to walk, erect, firm and steady, taking me where I want to go without complaints. Thank you, Lord, because I can move. From the happiness of having a perfect able body, I want to pray for those who are crippled, the amputees, the wounded and deformed, the paralyzed. I pray for them because I'm sure after this life of struggle for each movement, they will dance, run and jump freely in their new life. And last but not least, thank you, Lord, for my home. How wonderful it is to have a home. It doesn't matter if it is a mansion, a hut, a small room somewhere, a nest, a bungalow, or a charity home. May we find inside of it the loving figure of a mother or a father, of a husband or a wife, of a brother or a sister, the presence of a friend, the loyal company of a dog, someone to share our lives with. But even if I don't have anybody to love, neither a roof to shelter me or a bed to rest, still I will not complain. On the contrary, I will thank you, Lord. Thank you because I was born. Thank you because I believe in you. For your love, thank you, Lord.
Light of God. A stained glass window is illumined when the sun shines through, and its brilliant colors glow in a magic dance of light. The human soul, though made up of superior elements, will only reach fullness when permeated by divine clarity. Like a sparkling diamond, the human soul also becomes a shining star when perfected through suffering and dedication to the service of others. You must understand that your spiritual progress is of absolute importance, and you must not get entangled in the petty problems of everyday life, lest you will slow down your evolution. The unexpected obstacles a traveler meets with along a road should make him think up of ways to overcome them, but the traveler will thaw his pace if he allows the thorns and gravel which pave the way to hurt his feet. So bathe yourself in the divine light and let it illuminate the dark corners of your life where jealousy, spite, envy, indolence, and other moral imperfections have found shelter. Created for stellar glory, you are a cosmos in miniature. Emerging from the fiery nebulin of human passions, strive to gravitate in harmony with divine thought and do not go astray. The irresistible attracting power of God's love will lead us all to Him. Plunge yourself in the light of love so that the Spirit in you may radiate it, and then no shadow shall loom over your feelings. Your personal light will reach others and shine in the world. The light of God will kindle the spark of spiritual wealth within you, bringing out all your dormant virtues, and this light of God shall shake them out to life.
The process of dying itself is almost like one could say the process of the butterfly. You have the larvae gets into this process in which it goes going round and forms like a cocoon. In our physical body, it's more or less the same. And once this cocoon is ready, like in the butterfly, in the process of butterfly, eventually it breaks free from the cocoon and it flies. And it's exactly the same, could you say, almost a parallel process with the physical body and the breaking up of the freedom from the body into the spirit. It's almost like the flight of the butterfly. You become a spirit again, because in reality we are spirits. The life in the planet is just a passage, A true life, the one that we will live forever once we created the eternal being, is in the spiritual world. We have this passage through the earth at the moment. Maybe, as we grow and we change, we go to other planets. Eventually our planet will be consumed by a supernova, and we will go into a different planet. So we are always forever evolving, but it's the process of learning. And of course, within the spiritual world, one of the things that is very important, once we go into the spiritual world, we leave the physical body and we go into this process of dying, we will face a conscience. So whatever we've done in this life, we will have to answer for what we've done. But I think for me, one of the things that is very important in Spiritism is that God does not punish. There is no punishment aside. It's our own conscience that will call for the lessons that he needs to receive. It's not God that say you're going to different places, hell or anything like that. It's our own conscience that will call for the lessons we have to learn. We don't have a punishment, we have lessons that we have to learn. It's because this life is like a school. If we work hard, we study, we've learned, and we get our degrees and our master's degrees and our PhDs. But if we don't work so hard, it takes a bit longer. It takes time because it depends on ourselves and what we choose to do. And the lessons we have to learn is redemption for everyone. No one will be left behind in darkness. Everyone will be a being of light.
Now I've heard there was a secret chord that David played and it pleased the Lord. But you don't really care for music, do ya? It goes like this: the fourth, the fifth, the minor falls, the major lifts, the baffled king composing hallelujah, 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 hallelujah. Your faith was strong, but you needed proof. You saw her bathing on the roof. Her beauty and the moonlight overthrew ya. She tied you to a kitchen chair. She broke your throne and she cut your hair. And from your lips she drew the hallelujah. Hallelujah, 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 hallelujah. I did my best, but it wasn't mad. I couldn't feel, so I tried to touch. I told the truth, I didn't come to fool ya. And even though it all went wrong, I stand before the Lord of songs with nothing on my tongue but hallelujah. Yes, I stand. Hallelujah, 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 hallelujah. Oh,
God remains. Never feel deserted, lonely, or unhappy. God always remains with you. God is the generating power towards which all things and all beings gravitate. The positive energy that maintains the cosmic balance through the attracting power of the molecules come from Him. Because of that, we are all linked to one another in the great work of self-regeneration. The range of God's action expands itself throughout all nature. When circumstances seem to act against you, when illness enfeebles you, when unnumbered needs press on you, when after having taunted you, your friends and enemies leave you, God will remain with you. When a person falls, the cosmic balance is disturbed. When the person rises again, the universal balance is reset. You are an individual cosmos within the universe, and the laws that govern your destiny also determine a harmonious gravitation around the sun. God rests therein. Leaders guide your path. Teachers foster teachings. Laws rule over life. Your personal life writes pages in the book of the universe, which will influence other lives, and your examples will stimulate or discourage other people. God always remains by you, sustaining and guiding you to your final destination. You must never forget or disregard this fact. Seek and find God, for He remains within you.
I see trees of green, red roses too. I see them bloom for me and you. And I think to myself, what a wonderful world. I see skies of blue, clouds of white, the bright blessed day, the dark sacred night, and I think to myself, what a wonderful world. The colors of the rainbow, so pretty in the sky, are also on the faces of people going by. I see friends shaking hands, saying, how do you do? They really saying, I love you. I hear babies crying, I watch them grow. They'll learn much more than I'll ever know. And I think to myself, what a wonderful world. Yes, I think to myself, what a wonderful world.
You're driving, going on a trip, minding your own business on a beautiful road, when all of a sudden, you go through a hollow, a sunken place, and it is so big that you think to yourself, trip is over, and you can hardly see the road ahead of you anymore. In your life, this is called depression. The term, originally used to describe an action of lowering something, can be compared to the emotional sinkhole where, at times, we often get stuck in. Depression used to be known as melancholy, and it often had a certain romantic tone to it. Today, however, we know that depression is a very serious illness, Serious indeed, because there's nothing worse than losing the desire to live. When we add a vision of the integral being, of the immortal spirit who is going through a long, ever-progressing journey, and that this present life is only a chapter, perhaps even the most beautiful page of the book we call life, it becomes easier to realize what is truly important and no longer focus on matters related to the ego or towards that which is temporary. Once aligned with this cosmic perspective, Spiritism has a perfect and infallible recipe against depression: patience, trust in the future life, and a whole lot of work towards the good. That's right. Recognizing that depression is fueled by a continuous fixation on the self, the best medicine is to look outwards, towards the other, especially those most in need. Don't ever forget, traditional therapy and continuum medical care is very important, because once depression has installed itself, it does affect the physical body as well. What we're proposing is that you should also try to find yourself through charitable actions and love for your neighbor, maximizing the results of conventional medicine. You are not alone. It's time to be together. In the links below, you will find research material, assistance, and more, targeting the treatment and prevention of depressions. See you soon.
Forgive yourself. The Gospel states we should be indulgent with the faults of others, but strict with our own. To achieve self-illumination, we must keep a firm attitude of alert, day-to-day watchfulness over our own actions. When we understand that earthly life is intended to be an uplifting experience, it is only natural for us to learn a great deal through losses, which will turn into gain because of the reaction they will create. Aware of such reality, you must be tolerant with the faults of others. Be indulgent with your social circle and wherever you are. Although you must not accommodate to your own weakness, you should not be too harsh on yourself. When you fail, do not brood over your own faults, and do not vitalize your errors by concentrating upon them. When you fall down, pick yourself up and start over again. You are an ever-unfolding soul temporarily enrolled in the school of life. Each step forward leads onto a higher level. If you are pleased with yourself and stagnate, you delay your spiritual liberation. If you become bitter and depressed because you have made a mistake, you will also hinder your march. But if you acknowledge your personal limitations and understand your own mistake, you will find it easier to forgive others. When right, proceed. When wrong, forgive yourself, reconsider your actions, and move on. A loving person must love himself too. If you are tolerant with yourself, you will be stimulated to proceed along the spiritual road of progress, and your action will be more and more efficient, and your deeds more nobler.
If you're watching this video, you might be thinking, why should I go on? What's the point?
You'd be depressed, you could be lonely, and you might feel unloved and that nothing can change.
And you're probably thinking, how can somebody who doesn't even know me, doesn't even know what I'm going through, want me to solve my problem?
And you're right, what would I know about it? I'm not going through what you are. But one thing I do know is that whoever you are, you deserve to be here.
You might feel there's no way out from the depression you feel. Or you might feel that the only way out is to end it all, to end the pain. But it's not the answer.
You deserve to stay on this earth, to love and be loved, and to wake up in the mornings and just bask in your happiness in the sunlight.
Don't think about the future. Just focus on trying to get through today. They say live for your friends, live for your family, but I'm saying live for you. Live so that you can fix whatever problem you are going through right now.
So live your best life.
You will have love and happiness. So stay here to show that you deserve this place on earth, to show that nothing can shake you or your love. Talk to someone you love, and they will not judge you.
There is always someone who cares and is willing to listen. If you don't want to speak to anyone around you, you can always visit an online helpline and they'll help you and guide you through your difficulties.
And your bravery and determination, even if you feel like there's nothing of it right now, even if you're shaking your head right now and you know there's nothing inside you, I assure you that you are brave and it will pull you through.
This is not the end of your story. You can make it.
Are the psychics, or the mediums as we call on Spiritism, are they all trustable people? Can I trust them? What they tell, does it really come from spirits? And if so, does it come from good spirits, spirits well intended? First, not all spirits are well intended. Not all spirits are wise people. They are just like you and I, without a body. So a stupid person without a body is a stupid spirit. So everything that comes from spirits should always pass through your reason, pass through your mind. See what they're telling you. Does it make sense? Is it for your own good, or is it something really kind of weird? Is it something that's not going to be good for you or for the other people around you? Wise spirits, they never advise a bad thing. They never advise a thing that doesn't make sense. For example, if a spirit comes to you and say, every Monday you should use purple. Why is that? Doesn't make any sense. But if a spirit comes and tell you, you should be a good person, you should try to reconnect with your brother, you should try to become more calm, you should try to see a more broad way, you should see brothers and sisters in all kinds of religion, you should see brothers and sisters in all kinds of ethnical groups. Well, that's good advice. That probably comes from a wise spirit. Do not trust all the psychics, do not trust all the mediums. And a good tip there is, if the person charges you, do not go. Run away from that. In Spiritism, we believe that something you receive for free, you should give for free. So if you're a psychic, if you're a medium, in Spiritism, you don't charge for helping the other person with your abilities. So all to say that perhaps in Spiritism, there is free lunch.
Paz do mundo começa em mim.
pela paz, pela coragem de mudar. Paz pela paz, pela justiça, paz pela paz, a liberdade, paz pela paz, pela beleza de te amar. A paz do mundo começa em mim. Se eu tenho amor, com certeza sou feliz. Se eu faço bem ao meu irmão, tenho a grandeza dentro do meu coração. Chegou a hora da gente construir a paz. Ninguém suporta mais o desamor. Faz pela paz, pelas crianças, faz pela paz, pela floresta, faz pela paz, pela coragem de mudar. Faz pela paz, pela justiça, faz pela paz, a liberdade, faz pela paz, pela beleza de te amar. Faz pela paz, pro mundo novo, faz pela paz, a esperança, faz pela paz, pela coragem de mudar. Faz pela paz, pela justiça, faz pela paz, a liberdade, faz pela paz, pela beleza de te amar. Faz pela paz, pelas crianças, faz pela paz, pela floresta, faz pela paz, pela coragem de mudar. Faz pela paz.
Good afternoon, my dear friends. Me here again. But now I have a small surprise, talking a little bit about something very important here. That is our Congress. Do you know that since 2003, United Kingdom and International Medical Spiritist Association are organizing events since 2003, 2007, 2009, 2011, 15, 17, 19, and now. So we are now in our 8th Congress on Medicine and Spirituality. That is the great thing that we can have because we can include our studies with spirituality. As you know, I'm using a remote mobile, and the slides are in Adriano's computer, far from here, and these amazing things we can do in our days. So we have on our website, if you want to know about the previous congresses, previous speakers, previous topics, you can go to www.medspiritcongress.org. So you have everything there, even some photos of our first speakers in 2007. There was from Germany, Canada, Brazil, United States, United Kingdom. And we held for the first time the 3 psychiatrists, Dr. Andrew Powell, Dr. Peter Fennick, Dr. Alan Sanderson. That this great trio, these 3 people that are amazing and supporting us for several events, congresses, conferences, etc., not only in the UK, but in Brazil and in the United States. And Dr. Peter Fennick, 2003, he went to Brazil and participated to the MedNesp. That is a huge congress, more or less 2,000, 3,000 people every congress. So So the international one as well has a huge attendees, a huge number of attendees. For us, it's great because people come from all over the world and uniting medicine and spirituality. It's a medical spiritist congress. So this is the field that will improve our humanity. We are not a number. We are a spirit incarnate for 7 years, 70 years, or 100 years in a physical body. I am in my 70s now, and I am so grateful because it's in May, and our Congress in May, we can celebrate together my 70s with the 8th Congress of Medicine and Spirituality that I love so much. My next slide that I try here, yes. This is slide now is our institution, the Spiritist institution that unites some Spiritist centers in the UK that call BUSS, B-U-S-S, British Union of Spiritist Societies. We have free download books, 5 books there. We have a suicide, that all that you need to know is a book that preventing suicide, helping people to take from their minds, ending their lives. So it's a free book that BUSS published only to give to everybody as a PDF. You are welcome to download, to give to your friends in our website. Also, we are now together in partnership, disseminating this Congress through Kardec Radio. It's in America, started by Vanessa Anceloni, Dr. Vanessa Anceloni. She will talk later on. Is an amazing neuropsychologist, neurolinguistic, and neurospiritist person. So she has everything that we need to know regarding mediumship, and her talk will be amazing. So you can visit kardecradio.org or kardecradio.com, and you have amazing talks about spiritist awareness, health and spirituality, and more than 300 podcasts. You can find one that will be suitable for you, or you can learn with a lot of lessons that we have there. Also, as I mentioned before, Kardec Radio is celebrating 10 years now, so you can really appreciate the new information that they have there regarding videos or any other things you can find there. Also, the ones that has your mobile in your hand, you can point your camera to this QR code, and if you want to, if you speak English, of course you are here, you speak English, you can join in the through this QR code. You go to a form, you can fill 3 fields, and you can join only to receive information regarding the congresses or talks or conferences organized by British Spiritist Medical Association, that Dr. Peter Fenwick is the chairperson. So feel free to connect and go on. Also, a very nice research center that you can go and see so many things regarding psychiatry, regarding medicine, health, spirituality, is this núcleo. It is a university núcleo from Juiz de Fora, Brazil, organized by Dr. Alexander Moreira Almeida. He will be later on talking as well, a very important topic that is the field of religion, spirituality, and health, and science and medicine. And also you have several talks in English, easy to go, easy to download, easy to watch, easy to forward for your beloved ones or friends, that there are more things that we think in this field now. And a lot of people, a lot of scientists researching towards prayer, as Dr. Peter Fenwick spoke this morning, regarding spirituality as well, because you don't need to change your religion to be spiritual. You can add information from outsiders to your daily life. Here, you can go to youtube.com/noops, USJF. It's here, the link. I can put later on the link on the chat. It will be easy for you to see the information. Sorry, I go behind, forward. Yes, here your talks. And also, we are broadcasting today several videos, short videos from the Spiritist Academy, or iSpirit. So you can go there, www.spiritistacademy.com, and you have amazing topics, 3 minutes, 5 minutes, 1 hour, depend what you want, the time that you have. You can drive or in a train or in a plane, whatever. You can watch, you can listen. This topic is related with something that you are perhaps a question mark in your mind. So, my dear friends, we are launching today. Today, I don't know, it can be today for the world, because we are here now gathering with 15 countries, and together these countries are in the same tune with spirituality and health, or spirituality and medicine. But today, we are showing to everyone that you can go to Amazon and buy a small percentage for Bas. You can buy these 2 books at the Orchard House and learn how to pray. That's in early ages, you can conduct our little ones to be really spiritual, to understand that the life has a lot of challenges. And when you educate your child in a spiritual way, I'm not saying religion way. I'm not a religious person. I am a spiritual person. You can really give to your child a power for the future. They can face any problems in school or adult life. They can overcome. We understand that everything passes. All problems will pass as well. So, my dear all, we will have a special moment with a gifted lady, singer, composer, that is Anastasia McKenna. So I would like to thank you all for listening. I will now pass over to Natasha, a brilliant singer. She sings in Edivaldo's congresses, sometimes 12,000 people at the same time, or more than that, in one night. She sings to everybody, and is really amazing, Anastasia. So it's a pleasure to be here in the same field with you all. Thank you very much. Anastasia, welcome, my dear. Okay? Thank you all.
Elsa, good afternoon. Thank you.
A big hug for you.
I'm happy to be here, but this is our musical moment. I think the music is the voice of God here on earth. Music is the voice of the heart. I wish your hearts light, peace, and music. One day, our health will be full because we will take care of the essence of our spirit. The first song talks about that day, one day, somewhere, but the journey begins now. Kiss. There's a place somewhere, a place for us, peace and quiet and open air waits for us somewhere. There's time for next music, opera aria. Mio bambino caro, Giacomo Puccini. Oh my dear daddy. Oh my God. Okay. Let's go.
Oh mio bambino caro, mi piace il quando ricorda rossa a comperar l'anello. Sì, sì, ci voglio andare. E se l'amor se torna, andrei su Ponte Vecchio, ma per buttarmi ignaro mi stringo in me dormento.
Well, next music is my composition, Soul and Sweet Harmony.
A minha alma vai a buscar o infinito além de mim. Você não me abandona, pois eu tanto te esperei. Mesmo quando andavas nos caminhos, não perdida, esperava encontrar-te. A luz que um dia eu vi brilhante. Mesmo quando andavas nos caminhos, não perdida, esperava encontrar-te. A luz que um dia eu vi, e foi como despertar de um sono. Minha alma vai a buscar o infinito
Jesus going in my heart, in our heart. And now, next music. Em português, ok?
Oceania tem meu coração, essa paz que um dia eu tive na palma da mão. Fui feito passarinho, feito a ilusão que desfez um sonho e a calma que só tem na alma. Doce harmonia tem meu coração, dessa paz que ilumina. Jesus chegou aqui, oh, Jesus chegou aqui, oh, Jesus chegou.
Thank you, Luiz.
Oceania tem o nosso coração que veio dessa paz que ilumina. Jesus chegou aqui, oh, Jesus chegou aqui, oh, Jesus chegou. E
Next music is a fado. Fado from Portugal.
Bem pensado, todos temos nosso fado, e quem nasce malfadado, melhor fado não terá. Fado é a sorte que do berço até a morte ninguém foge por mais forte ao destino que Deus dá. ser fado não terá poste, fado é a sorte e o berço até a morte. Ninguém foge por mais forte ao destino que Deus dá. Ninguém foge por mais forte ao destino que Deus nos dá.
Thank you, Humberto. Thank you for you. Next music in Portuguese is Oração de São Francisco de Assis.
Senhor, fazei-me instrumento de vossa paz. Onde houver ódio, que eu leve o amor. Onde houver ofensa, que eu leve o perdão. Onde houver discórdia, que eu leve a união. Onde houver dúvidas, que eu leve a fé. Onde houver erro, que eu leve a verdade. Onde houver desespero, que eu leve a esperança. E onde houver tristeza, que eu leve alegria. E onde houver trevas, que eu leve a luz. Ó Mestre, fazei com que eu procure mais consolar que ser consolado, compreender do que ser compreendido, amar que ser amado, pois é dando que se recebe, é perdoando que se é perdoado, e é morrendo que se vive para a vida eterna.
The next music is Christian song. Hallelujah. and universal music. Music very special. Johann Sebastian Bach and Francois Charles Gounod. Ave Maria. And me see now my favorite things. Raindrops from sisters and a kittens, copper carrots, one woolen brown paper packets tied up with these strings. These are a few of my favorite things. Ponies, peppers, strudels, doorbells, sleep bells, she's ever no rose. White is the fly with the moon on their wings. These are a few of my favorite things. Grown white and dresses, sweet blue sitting sessions, snowflake that stay on my nose and eyelashes. Few autumn winter that melt into spring. These are a few of my favorite things. When the dog bites, when the bee stings, when my feelings sad, I simply remember my favorite things, and then I don't feel so bad. La da 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 da. Raindrops and roses, they whisper. Copper carols, the warm little medians,
tied up with strings. These are a few of my favorite things. Green color ponies and crisp strudels, doorbells and sleigh bells, she's everdoros. White is the fly with the moon on the wings. These are a few of my favorite things. Girls white and dresses with blue satin sashes, snowflake the stay on my nose and eyelashes, silver a winter that melted to spring. These are a few of my favorite things. When the dog bites, when the bee stings, when my feelings sad, I simply remember my favorite things, and then I don't feel so bad. I simply remember my favorite things, and then I don't feel so bad. My friends, thank you. Last music is Smile. God bless you. Smile, though your heart is aching. Smile, even though it's breaking. When there are clouds in the sky, you get by. If you smile, if you feel a sorrow, smile. We may meet tomorrow. You see the sun come shining through. For you, smile, light up your face with gladness. Hide every trace of sadness. Although a tear may be ever so near, that's the time you must keep on trying. Smile, what's the use of crying? You find that life is still worthwhile if you just smile. Let it out. That's the time you must keep on trying. Smile, what's the use of crying? You find that life is still worthwhile if you just Bye bye. Hello.
Thank you so much, Marlene. Beautiful Nightingale. Yes, you made us go to the clouds. At least in these moments that we have so many people dying, departing, as yesterday, friends saying goodbye and going, your voice brings us assurance that we are still in connection. Thank you, Anastasia, you are beautiful. Thank you, all of you that are watching Anastasia, and she's receiving our thank you from our heart. Good energy for you, my dear. See you next Congress, in person now in London. Okay? And Thales.
Thank you, Elsa. Thank you, my friends. See you. See you. God bless you.
Bye-bye, dear. God bless you.
Bye-bye.
Bye-bye, sweetie. Thank you. Was over to now, Adriano. Carry
Correct
on.
yourself. The world looks fascinating and overflowing with emotions. You may feel attracted to it and wish to give yourself up to earthly pleasures. You see people parading by, looking carefree and happy, as if for them life were an endless party. You watch people on television, read about the socialites, and see others in movies or meet them in the streets. And you feel uneasy and frustrated, empty inside, and it seems to you that you lead a dull life with unending responsibilities and imperative duties. Then you think life is too hard for you, and plunge into a growing depression until tears roll down your face. Correct your attitude. Review your appreciation of facts and circumstances. Maybe those who look so happy are not really so. Most of them are just selling a self-image to impress the weak. Others, who are affluent, may be sick of life and keep themselves on drugs to chase away their boredom, helplessly trying to get away from themselves. All is transitory on earth. Those who live irresponsibly will one day fall prey to depression, drugs, insanity, or suicide. Physical decay is a law of life which cannot be dodged by anyone. Old age and death are natural phenomena. Nevertheless, those who govern their bodies wisely, attune their minds to the divine inspiration, never grow old and never die, for they will maintain an inalterable spiritual health, both in death and in the blessing of survival. God knows. There are different moments in your life when, engrossed in problems, you feel ignored and think nobody knows the troubles you bear. God knows. Sometimes you may feel desperately unhappy and totally deserted. Still, you will not be alone. God knows the reason of your suffering. When in deep anxiety and abused and detracted by slander, you wish to abandon your task. Put your faith in God and wait. God knows why this must be so. Surprised by a cruel fate which thwars your most cherished plans, do not give yourself up to revolt and do not despair. God knows what is best for you. Crucified by a disease of unknown cause, bow your head in prayer and wait a little more. God knows your disease is the path to future happiness. God knows everything. Just let yourself be guided by Him. Seek attunement to His mercy and wisdom. Do the best you can and leave a trace of light along the road you travel. For such is the attitude of the one who has put himself in the hands of God, and whom in God shall progress. Faith in you. Fanatism is a distortion of faith and reveals a distortion in the act of thinking. Systematic disbelief reveals emotional conflict and unstable reasoning. People believe both because of evolution and as a psychological inheritance. Not every faith is necessarily rational. There are many who believe automatically and naturally. We discern two kinds of faith, rational and natural. Natural faith is innate. Rational faith emerges from reasoning and thought. Faith, being a virtue that must be worked out individually, uplifts, opens up to new views of life situations, prompts inner peace, and strengthens the soul to face adversities. When faith comes out of reasoning, it becomes a light that illuminates the most confusing and complex situations. However, whichever faith you are plunged to, let it be vitalized by love, so that it may become a positive energy to be used for others. Faith is an active part of the spiritual nature of man and must be kindled by prayer and meditation. Do not submit your faith to tests. If it is real, it will be there when you need it. Learn to trust your values. Man believes by instincts, by simulation, or through reason. Reset your faith in God and carry on the good work, for you have been created for a happy and healthy life.
Edelweiss, every morning you greet me, small and white, clean and bright, you look happy to meet me. Blossom of snow, may you bloom and grow, bloom and grow forever. Edelweiss, Edelweiss, bless my homeland forever. Small and white, clean and bright, you look happy to meet me. Blossom of snow, may you bloom and grow, bloom and grow forever. Edelweiss, Edelweiss, bless my homeland forever. Sei stille dem Herrn und warte auf ihn, der wird dir geben, was dein Herz wünscht. Sei stille dem Herrn und warte auf ihn, der wird dir geben, was dein Herz wünscht. Der wird dir geben, was dein Herz wünscht. Befiehl ihn deine Wege und hoffe auf ihn. Befiehl ihn deine Wege und hoffe auf ihn. Steh ab vom Zorn und lass den Grimm. Sei stille dem Herrn und warte auf ihn. Warte auf ihn, sei stille dem Herrn und warte auf ihn. Der wird dir geben, was dein Herz wünscht. Der wird dir geben, was dein Herz wünscht. Der wird dir geben, was dein Herz wünscht. Sei stille dem Herrn, sei Stille dem Herrn, uns warte auf ihn.
God's presence. When trouble and fear threatens to disturb you, remember God's presence by your side. Wisdom and love, confidence and peace, though invisible, are more powerful than afflicting and disquieting states of mind. In God's presence, you can unite heart and mind and spirit. God's presence clarifies your reason, banishes the shadows that might blot out your discernment, and helps you to meet the daily occurrences of your life with a good disposition. God's presence inspires you and opens up new spaces for future realization in joy and peace. It also conveys self-assurance, re-establishes the order, and enhances your potential values. In your arms, share your joy with those who have given themselves up to pessimism, so that they may renew their own energies and continue to perform their duties. There are endless possibilities at your disposal that might have remained unnoticed because you were groping to the shadows and could not see them. But with God's presence, your possibilities become easily accessible, and His loving arms hold you in waves of power that protect you and enhances your achievements. All the good you experience, all the good that nurtures you and is distributed through you, is possible because of God's presence in you.
Hello, good afternoon, and welcome to this 8th British Congress on Medicine and Spirituality. Thank you very much to the musicians who've played during the break. Quite amazing. Thank you so much to Moacir, to Anastasia, to Mauricio, Lucas, and Publio. That was really a feast of music and song and spoken verse. Now, the order for today is the first speaker is Dr. Alexander Moreira Almeida, and then there's Dr. Vanessa Anceloni, then myself, and then there'll be some remarks, closing remarks, with Dr. Peter Fenwick and Dr. Sonia Doi, and Sylvia Gibbons will say the closing prayer. So may I introduce the next speaker? Is he available? He's not here yet. So he'll be here in just a few moments. So perhaps we can have another song while we're waiting for him to arrive. Is that possible, Adriano?
Sonhar, mas sonho impossível. Lutar quando fácil ceder. Vencer o inimigo invencível. Negar quando a regra vender. Sofrer a tortura implacável. Romper a incabível prisão. Voar convite improvável, tocar o inacessível chão. É minha lei, é minha questão, virar esse mundo, gravar esse chão. Não me importa saber se é...
Hello, thank you for that interlude. Now, our next speaker is here. May I introduce you to him? He's Dr. Alexander Moreira Almeida, and he's an associate professor of psychiatry and a founder and director of the Research Center in Spirituality and Health at the School of Medicine in the Federal University of JF in Brazil. He's also chair of the section on spirituality of the Latin American Psychiatric Association. And he's former chair of the sections on religion, spirituality, and psychiatry of the World Psychiatric Association and the Brazilian Psychiatric Association. He's obtained a medical degree at UFJF and was trained in psychiatry and cognitive behavioral therapy at the Institute of Psychiatry of the University of São Paulo, Brazil, where he also obtained a PhD in health sciences, formerly a postdoctoral fellow in religion and health at Duke University. Dr. Alexander, is there anything else that you would like to say about yourself before we begin?
No, thank you very much. It's a great pleasure being here with you, with everyone who is watching us.
Thank you.
Okay. Hello, let me share my presentation. Just a minute. Okay, here we are. Okay, first of all, I'd like to congratulate all the organization of this meeting. I've been watching the previous presentations, and congratulations for the high quality of this Congress and the bringing to a broader audience the importance of integrating spirituality and health. And here in my presentation, I will talk about the biopsychosocial spiritual approach to health in clinical practice, to show the importance of taking spirituality into consideration. But of course, taking spirituality into consideration does not mean to neglect the other biopsychosocial aspects of health as a whole. Okay. So my presentation will be strongly based on these three sources, these three main references. This first is a book that we've edited with some other colleagues, and also Peter Fenwick is one of the contributors of this book. This book will be published by Oxford University Press this August. So it brings together the collaboration of many different authors about the clinical implications of spirituality to mental health. We also discuss about the World Psychiatric Association position statement on spirituality and religion and psychiatry. It's a guideline for the more than 250,000 psychiatrists around the globe about the need to take in consideration spirituality in training, research, and clinical practice in psychiatry. And also, we will discuss a little bit about the spiritist views of mental disorders, about how the spiritist views on mental disorder integrates the biopsychosocial spiritual approach. Since we are here in the Congress of the British Medical Spiritist Association, so I think it would be interesting to integrate also this perspective. First of all, let's discuss what do we mean by spirituality. There are several definitions about spirituality, but the core idea of spirituality is the relationship with the transcendent, a transcendental realm of reality that is considered sacred, the ultimate truth or reality. The major idea is that in the universe, there is a transcendental aspect that goes beyond the material world, the physical particles and force. And this transcendental realm is the sacred, is the ultimate reality. And religion is the institutional or communal aspect of spirituality. When people share a set of beliefs, experience, and practices to foster the transcendent and the sacred. Okay. It's very important to understand that spirituality and even religiosity is not declining in our current world. This is probably the most recent worldwide survey about religious beliefs from the Pew Research Center. Pew Research Center is probably the most important research center on global religiosity. The most recent finding for about 40 years ago, they found that 84% of the world population has some religious affiliation. And among the 16% that is religiously unaffiliated, most of them have some type of spirituality, such as beliefs in God, gods, spirits, whatever. So, and what is even more interesting, there are several projections, and even in the Pew Research Center also, that the number of unaffiliated is already decreasing and probably will keep decreasing in the next decade. So this is a prediction through 2060 based on the current trends. So we can see here, so probably the number of religiously affiliated people in the world will even be bigger higher than we have nowadays. So it highlights us the importance of taking consideration this aspect of human experience. However, we know, at least in the last 2 centuries, there has been a narrative of a perennial conflict between science and religion. However, this narrative of a necessary incompatibility, a necessary conflict between religion and spirituality is not accepted anymore in the scholarship, in the good academic environment regarding history of science and science of religion. So here we have 3 very important books published by University of Cambridge, of Oxford, and of Harvard. 3 very good reviews that undermines this prevalent and mistaken perspective that science implies in the negation of spirituality and of religion. So it's very, very worthwhile to take a look in some of these books. So we can understand, of course, that there were some conflicts between some religious people and some scientists, but it's not true that this is the rule, actually. Okay? So just to give you an idea, Ronald Numbers is considered probably one of the best historians of science nowadays, and he edited a book published by Harvard University Press called Galileo Goes to Jail and Other Myths About Science and Religion. It has 25 different myths on science and religion written, each chapter written by a historian that is an expert in that specific subject. And it's interesting, in the introduction of the book, Ronald Numbers states that the greatest myth in the history of science and religion holds that they have been in a state of constant conflict. This is the greatest myth. And when I read for the first time this book that was launched in 2009, I was astonished by the second statement. No scientist, to our knowledge, ever lost his life because of his scientific views, because of religious persecution against these views. So there is no scientist registered in history that lost his life because of religious persecution against his or her scientific views. So it's very, very worthwhile to take a look at this scholarship. But nowadays, since we know that most of the world population has a religious affiliation, and by large, even more have some kind of spirituality, we know now also that religion and spirituality are not necessarily in conflict, by quite the opposite very often. But what have been the findings about the implication of religion and spirituality on health? Professor Fenwick previously presented some findings on this, and here we will present basically a basic summary. There are currently actually more than 3,000 empirical studies investigation the correlation between spirituality, religiosity, and health. On average, these are the most substantial findings and the more robust findings that have been registered. First, the higher levels of religious and spiritual involvement is usually associated with lower general mortality, lower depression, and even higher and faster remission from depression, lower suicidal behavior, lower substance use and abuse, and a higher quality of life, well-being, and human flourishing. Of course, there is always the dark side of the force. So there are also some negative impacts, but thankfully, these negative impacts are much less common than the positive impacts. And these negative impacts are not really specifically related to any specific religion, but much more in the way people deal with their own religiosity and spirituality. So the negative religious coping, for example, having a very negative view of God, extrinsic religiosity, people that are basically wanting to take advantage of religion, then actually try to live fully the religious beliefs. And also when religions conflict against treatment, when they oppose regular treatment. So these are some sorts of negative impact on that. Just to provide an example, this is of some findings of recent studies. This is a large study published by a group from Harvard University, published at Journal of American Medical Association. They followed up 70,000 people for 16 years. After controlling for a huge number of sociodemographic and even clinical variables, they found that, on average, people who attend at least once a week a religious service had half of their mortality compared with those who did not attend. So it decreased by half the mortality after controlling for many sociodemographic and clinical variables. And the main mechanisms, the main mediators, so which factors were related to church attendance that would impact mortality. We could see here that people who attended more regular religious services, they had lower depressive symptoms, lower levels of current smoking, higher optimism, and higher social integration. And these were the main mediators of the impact of church attendance and lower mortality. Specific about suicidal rates, we know nowadays that suicide is a huge public health problem, and this is another study from the same group from Harvard, led by Tyler Van der Wielen, one of the major names in epidemiology worldwide nowadays. They followed up almost 90,000 people for 14 years. On average, after controlling for many sociodemographic and clinical variables, they found that people who in 96 attended religious service at least once a week, throughout these 14 years of follow-up, they died 7 times less of suicide than those who never attended. Or, saying in different way, people who never attended religious service died 6 times more from suicide than those who attended at least once a week. It's hard to find in epidemiology of suicide any other factor so strong as this. In addition to this, there are also several studies investigating the impact of integrating spirituality in clinical approaches, in treatments. This is a systematic review with meta-analysis developed by a group of colleagues here from Brazil, and they investigate the impact of religious and spiritual interventions in mental health. In this meta-analysis, they found a positive impact of these treatments on anxiety, for example. So the integration of spirituality, the treatment, impacted positively, decreasing the level of anxiety symptoms in patients. This in a meta-analysis of very different studies. But it's very important to stress, we cannot stress enough, that when we are emphasizing the spirituality, of course, we are not denying the bio-psycho-social aspects of mental health. Quite often, we take an approach of one approach or another. So should we prescribe medication, or should we take in consideration the spirituality, or should we take in consideration the social aspects? Of course, we don't need to choose between these approaches. Because we, human beings, we are a whole. We have biological components, our body, our genes, our hormones, neurotransmitters, etc. We have our psychological functioning, the way we see things, the way we deal mentally with the stressors that we face. Of course, we have a social environment where we live, our social relationships, our stressors, our supports, and so on. And of course, we are also spiritual beings, or perhaps we are mainly spiritual beings in a biopsychosocial environment. So, of course, I'm here in my presentation stressing the spiritual aspects, but I'm not at all denying all the other aspects. This is a very important warning. Quite often, in the same way we see people strongly biologically oriented minds neglecting spiritual aspects, we also see the extreme opposite, people with a more spiritual approach denying or neglecting the biological aspects. We don't need to do this. And actually, as we will present briefly, the spiritist approach of health does not require that. On the opposite, it stresses this whole. And I like very much to see the health and disease balance is like a scale like this, where we have the pathogenic factors and the salutogenic factors. So we have factors that promote health, the salutogenic factors. And we also have factors that promote disease, the pathogenic factors. And of course, all of us have pathogenic factors, biological pathogenic factors. For example, some genetic predisposition, our diet, our lack of physical exercise, whatever, use of substance. Many of them, all of us also have some psychological, negative psychological aspects, social negative aspects, and spiritual negative aspects. But also, we also have positive, salutogenic, biological, psychological, social, or spiritual aspects. The main focus, the main goal on in preventive medicine and also in promoting the treatment, restoring the balance, is when we can decrease the weight of pathogenic factors and increase the weight of salutogenic factors. So the scale will tilt to the salutogenic side. So the major point in treatment and in prevention is to decrease the pathogenic factors and increase the salutogenic in all the 4 dimensions, because they work in a synergistic way, collaborating with each other to restore balance. So exactly because of this, the WPA position statement from the World Psychiatric Association emphasizes that it's important to understand the impact of spirituality and religion to the origins, the treatment of psychiatric disorders, and also to patients' attitude. It should be central to clinical and academic psychiatry. So we need routinely to take into consideration these aspects of our patients. Who would like to know more about this position statement? It's available online, freely online on this website from the WPA section on religion, spirituality, and psychiatry, religionpsychiatry.org. And this position statement has been translated to 6 different languages, to Arabic, Chinese, French, Spanish, to Portuguese. So everything is available on this website for free. So what about the interventions? So let's talk about the spiritual interventions. First of all, one very good intervention is simply taking spiritual history. Is asking the patient, okay, do you have any spiritual religious beliefs or practices? How do they integrate in your life? What is the impact of these beliefs, of these practices in your life? How do they relate to the current stressor or disease that you are facing now? These very simple questions have impact. There are some evidence nowadays that just by asking these questions, taking 2-3 minutes can increase the patient satisfaction with treatments. These studies have been performed among oncologic outpatients, in general medicine inpatients, and other samples. In addition, because if we ask patients about their own religion and spirituality, they understand that we are taking them in consideration as a whole person, not just a set of symptoms or a specific organ. In addition, we could also have a collaborative approach, exploring potential useful spiritual resources from the patients. This is essential. The approach is never imposing the professional's beliefs on spiritual beliefs or anti-spiritual beliefs. This is also important because there is evidence that not only sometimes religious professionals would like to impose their religious beliefs, but quite often also anti-spiritual professionals would like to impose their anti-spiritual views, neglecting or denigring the spiritual beliefs and practices of their patients. So the treatment must be patient-centered. It doesn't matter what we as professionals believe, but what actually matters, what matters to the patient. So in a collaborative approach, we need to explore potential useful spiritual resources, like we need to explore potential social resource, potential useful psychological resources, and so on and so forth. So, for example, some potential useful spiritual strategies, reading religious texts. Many people feel peace, guidance, and solace in reading religious texts. The cognitive framework, how they make sense of the problems that they are facing, how they make sense to the challenges of life. Some religious rituals, listening to or watching religious spiritual programs. Prayer, meditation, community service, attending religious service, deeper integration with their faith communities. This is part, for example, of behavioral activation that is a kind of treatment for depression. So we could foster this positive religious resource. In addition, there has been a growing recognition in mainstream academic environment about the importance of taking into consideration a partnership between health professionals and religious communities. For example, The Lancet, the very important British medical journal, published a few years ago a series called Faith-Based Healthcare. It's very important to take a look at this series of paper because they discuss the importance of taking into consideration this partnership with faith communities in delivering healthcare, in making also more efficient preventive measures. Some other examples here, the American Journal of Public Health, there is also a recent editorial about this partnership. We published also a few years ago a paper, also in a British psychiatric journal, about the contribution of faith-based health organizations to public health. So, and more recently also, a very good book published at Springer by an important epidemiologist about the impact of religion and spirituality for public health. So it has been more and more recognized and acknowledged this kind of impact and importance. So, as we said previously, here we have a paper that is an overview of some clinical guidelines about how to integrate in an evidence-based and also in an ethical way spirituality in clinical care. Of course, as we said previously, it must be patient-centered, not prescribing, not imposing, neither religious or anti-religious perspectives. We need to take in consideration all aspects of human being, physical, mental, social, and spiritual. Also, we need to have an open-minded approach with a genuine interest and respect by patients' beliefs, values, and experiences. Now, since we have this more general perspective, since we are in a congress about the from the Spiritist Medical Association, what is the approach of Spiritism regarding this biopsychosocial spiritual approach? So we published some years ago a paper about the Spiritist views of mental disorders. It's interesting, as I said previously, because in this paper we reviewed the views not only of Allan Kardec, that is the founder of Spiritism, but also some leading authors like Inácio Ferreira, like Joana de Angelis. So they propose, as I said previously, a biological, psychological, and social approach, the importance of these aspects for the theology of mental disorders, but also the Spiritism adds a spiritual aspect, a spiritual component. So the point is not to deny the biopsychosocial aspects, but to add, to say, okay, it's very good to take consideration biopsychosocial aspect, but it's not the whole story. We need to add something else, the spiritual. And not only spiritual in the sense of beliefs, of community. Of course, this is important. The spiritual beliefs, the sense of community, the rituals, all of this is important. But in addition to this, the Spiritism adds two other key factors. One is the obsession as etiology, as a negative influence of discarnate spirits, and also the idea that past lives can be, for example, a cause of traumas, phobias, and things like that. And based on this, the treatment would include the conventional treatments, psychiatric drugs, psychotherapy, but in addition to them, not replacing them, but in addition to them, this obsession is a mediumistic treatment for obsession, prayer, lay on of hands, called passes, a spiritual outlook of life. This is very important, according to the Spiritism, that this point of view, that this vantage point proposed by Spiritism, that we are spiritual beings having this bodily experience, that we exist from beyond the birth and after our death. And so we have a much higher and wider perspective of life, and also the strong emphasis in charity. Charity understood as love in action, in living love in all our relationship, and the emphasis on charity and ethical transformation. One of the, perhaps the most important first example, systematic example about the integration of psychiatry and Spiritism was Inácio Ferreira. Inácio Ferreira was a Brazilian psychiatrist who ran for 50 years the Spiritist Sanatorium of Uberaba. Uberaba is a city in Brazil where, by the way, the medium Chico Xavier lived for many years. So he was a director of a Spiritist psychiatric hospital. Okay, probably the first Spiritist psychiatric hospital, and he was probably the first Spiritist psychiatrist, and he published several books with case reports. So we published this this paper at the Journal of Society for Psychoresearch some years ago. So it describes in more details his interventions. Basically, in his interventions, he include exactly this sort of treatments. And more currently, we still have in Brazil dozens of Spiritist psychiatric hospitals. This is also a paper with an analysis of 6 large Spiritist psychiatric hospitals in Brazil. This is an analysis of their profile. Okay, it's also published in a regular mainstream psychiatry journal. Okay, so most of them provide free services, or they were related to the public health system. Okay, and all of them have multidisciplinary teams. Of course, they do not emphasize only the spiritual aspect. They have the spiritual as a complementary aspect of the treatment. Okay, this is the pictures of some of these hospitals. And these are the major mental disorders categories that they treat. Of course, as expected, most of them were depressive disorder, drug addictions, and psychotic disorders. And basically, they combine conventional psychiatric treatment with voluntary-based spiritual approach. This is very important, because in Spiritism, all spiritual activities are completely free of charge. Okay, there is never, it's never asked for any payment or any retribution. It's always understood as a charitable enterprise. So this complementary spiritual treatment is always provided by Spiritist volunteers. So this treatment includes laying on of hands, talks and conversations on spiritual and ethical issues, and also lectures and also personal interviews on that. Intercessory prayer. The Spiritist release therapy, it's called subsession, and what they call the fraternal dialogue. That's exactly an in-person conversation, Spiritist topics. They are complementary and optional. Of course, the patients can say, okay, I don't want to receive these treatments. Of course, they are respected regarding that. They do not interfere with conventional treatment. They are always free of charge and provided by volunteers. This is also another paper published about the acceptance of this religious assistance, specifically in a Spiritist psychiatric hospital in the city of São Paulo, the John Evangelist Hospital. In 213 patients interviewed in the admission to the psychiatric hospital, it was asked about their religious affiliation. We can see here that most of them were not Spiritists. Only 12% were Spiritists. Okay, but despite that, most of them requested it because they were asked if they would like to receive spiritual assistance. We can see that by large, most of patients request, even people who had no religious affiliation, about 80% accepted spiritual assistance. And also they were offered different sorts of spiritual assistance: Spiritist, Catholic, and Evangelical, the 3 major religious groups in Brazil. So we can see here that even the Spiritist approach was quite well accepted, even by those that were not Spiritists, like the non-religious affiliation, Catholics. The lower acceptance was basically among the evangelicals. And here, another very interesting also, so we discussed previously about psychiatric hospitals, now about the public health relevance of the Spiritist groups. So this is a study also published a few years ago in a psychiatric journal about 55 Spiritist centers in São Paulo. So these 55 Spiritist centers were surveyed about what kind of spiritual treatment they provided and about how many people attended and things like that. So on average, each spirit center attended more than 100 people every month. So as a whole, all the 55 spirit in São Paulo, there are much more than 55 spirit centers. Just to give an idea, my city, Juiz de Fora, is a 500,000 people city. It has more than 50 spirit centers, only a 500,000 people city. São Paulo, that is, 12 million people, has hundreds of spirit centers. But only among these 55 spirit centers, they attended on average 6,000 people every month. They had 95 volunteers, including physicians and other health professionals. The most cited health problem for people seeking the support from spirit centers were depression. And the most offered treatments were laying of hands, a fraternal dialogue, lectures, talks, prayer, and disobsession. Unfortunately, we don't have still studies about the impact, systematic studies, not many studies about the systematic impact of these practices, but they are currently in the way. And also, for example, another example, both in Brazil and Puerto Rico, Spiritism has a strong influence. And also discussed about how the Spiritist centers help deal people with schizophrenic and psychotic experiences, how they dealt with their disease, where they cope with them. So we found that the Spiritist approach helped them to provide a cognitive framework to make sense of their experience, provide social support to patients and relatives, and also this experience varied from anomalous but non-clinical experiences, so non-pathological anomalous experience, actual spiritual experience, to schizophrenia. And of course, there were some cultural adaptations of this Spiritist approach in Puerto Rico and in Brazil. Another example about the integration of this is I studied. These are 2 PhD dissertations that we mentored from Adair Menezes and Letícia Alminhana. We investigated 115 people who seek the help in Spiritist centers in Juiz de Fora, Minas Gerais, here where I live. We investigated 115 people who seek the help in Spiritist centers because they were having disturbing anomalous experience. And they were recognized by the Spiritists groups as mediums. Okay, so they were understood by the Spiritist centers as people having troubled mediumship. Okay, so what were the most frequent anomalous experiences that they reported? What we are using here, the language used by the Spiritist center. Clairvoyance, that's basically visual hallucinations. They were seeing things, 63%. They were hearing things, 54%. They were have anomalous dreams, dreams of precognitions, other sorts of dreams, out-of-body experience, premonitions, all this. So very different, a wide range of different anomalous experience. But what was interesting is that we found that in this sample, we did not find high level of psychotic disorder, but we found high levels of anxiety disorders. It's very interesting because when people have this sort of anomalous experience and they don't have a cognitive framework to make sense of it, and they don't have a social environment supportive of their experience, it of course raises a lot of anxiety, specific fears about their own health, mental health balance. Because quite often they think, oh, I'm going to become crazy, or I'm under some demonic influence. So neither is a good option. So it raises a lot of anxiety. So there are several studies showing when people have a cognitive framework and social environment that's supportive to them in this anomalous experience, these anomalous experiences tend not to be disturbing when they are non-pathological. Of course, we can have anomalous experiences that are actually symptoms of a psychotic disorder, bipolar, schizophrenia, so on and so forth. Okay, so of course they need spiritual support also, but also they need the medical treatment and psychological treatment and so on. And we performed a 1-year follow-up in that previous sample of 115 people. And we tried to detect which were the psychological predictors of higher or better quality of life 1 year later. It's very, very interesting that having unusual experience are exactly this experience. The number or the frequency of this experience was not a predictor of quality of life 1 year later. So it's interesting because just having that anomalous experience were not predictor. However, having, in addition to this experience, cognitive disorganization, that's actually a more specific symptom of psychotic disorder, in this way, yes, it was related, could predict a worse quality of life later. On the other side, if they have higher levels of ego strength, that's measured by self-directness, it predicted a better quality of life later. So that's the point. When people have anomalous experience, but if they have at the same time a strong ego structure, self-directness, social support, they tend to go better. But on the other side, if they already have some cognitive disorganization, if they had other symptoms of mental disorder, not only that a specific anomalous experience, it's a predictor of worse outcome. It's similar finding that we found with another study with 115 well-experienced mediums in São Paulo. Okay, we investigated 115 mediums who were, the previous study was people who were just seeking help in spiritist centers. And there they were understood as mediums and to start their development and so on and so forth. But here, this study, no, it's people who were already involved in the spiritist centers. They were working as mediums in the spiritist center. We found among this sample, we published some papers on this, a low prevalence of common mental disorder, a low prevalence of anxiety, depression, of somatic symptoms, okay? And also a good level of social adjustment. And what was more interesting, the frequency of incorporation of full trance actually predicted lower anxiety, depression, and higher social adjustment. Different from what people could think. Okay, these mediums were just some kind of less severe form of psychotic disorder. It's not the case, because the higher the frequency of these experiences, the better were the social adjustment and mental health. And because of that, we have proposed some criteria for a differential diagnosis between spiritual experiences and mental disorders. So we have worked, including in the ICD-11 work group, to propose some criteria that could help us. So some criteria are psychological suffering. When there is a lack of psychological suffering, is much more suggested a non-pathological experience. But as I said previously, sometimes psychological suffering is caused because there is no cognitive framework or social environment that support this experience. When there is no functional impairment because of this experience, they can still keep working and take care of themselves or their relatives, so on and so forth. It's also a very important aspect, the absence of psychiatric comorbidities. As we said previously, for example, in a schizophrenic case, in a patient with schizophrenia, in addition to having visions and hearing things, the patient also has cognitive disorganization, blunted affect, other symptoms of the syndrome of schizophrenia that are not present in a psychiatric disorder. Okay, and also very important, they can learn to control the experience with good training, different from mental disorders. And also they experience personal growth over time, different from sometimes a disorganizing effect of more severe mental disorders. So, in summary, I will open the floor for some, to open the floor, to have some space to some questions. I'd like to finish in stating the reasons for integrating religion, spirituality, and mental health. First, most of the world's population has some religious spirituality. It's a very usual coping strategy. It impacts health. Addressing religious spirituality impacts prognosis. Patients want clinicians to address religious spirituality. There are a lot of studies on this. It's a component of the integral patient's assessment, biopsychosocial spiritual approach. And it's actually recommended by mental and medical and health organizations, as we presented previously. So here are the main reference about this talk. And also for those who'd like to go deeper and having more research about spirituality and health, about spirituality and science, there is this YouTube channel for our research group, Noops TV. It's bilingual. Most of videos are in Portuguese and in English. Okay, more than 300 videos from different authors, from different perspectives. We have including several British scientists, philosophers, historians, physicists in this channel. And here, finally, are my contacts, my social media. If you'd like to be in touch, it would be my pleasure. Thank you very much. Let me stop sharing.
Thank you very much, Dr. Alexander, for your wide-ranging talk. Can I ask you, the forthcoming book that you've got coming, can you say anything more about the content of the chapters in it? Okay, great.
So this book, Spirituality and Mental Health Across Cultures, this book also is edited in the co-editor with me in this book is another Brazilian colleague, Bruno Mosqueira, but also Dinesh Bugra. Dinesh Bugra is from the Institute of Psychiatry in London. He is the former president of the World Psychiatric Association. The book, we are very, very happy, we're very excited with this book because basically most of the most prominent authors around the globe in the field contribute to this book. The book has 3 parts. The first part is about a more theoretical approach. How can we understand the connections between spirituality and health? What are the main evidence about this impact and things like that? The second part is about specific religious spiritual traditions. So we have a specific book, chapter about Islamism, about Christianity, about Buddhism, about spiritual but not religious, about atheism, how these different perspectives of patients impact their own health, and how what the clinicians need to know about these specific traditions to help them to understand and to integrate their beliefs in their approach. And the last section, I think it's one of the most important also, is the practical implications. So how can we integrate this in our clinical practice? Because nowadays, we have a lot of evidence about the impact of spirituality and health. One of the major challenges is how can we translate this knowledge to our clinical practice? How can we perform a clinical practice that is evidence-based, but also ethically sound? So this last part is exactly about these practical guides. For example, in taking spiritual history, in integrating spirituality in psychotherapy, in making the distinction between spirituality and mental disorders and things like that.
All right, thank you. And can I ask you what kind of steps can be taken to ensure that your material and the material of Dinesh Bugra is taken on board in the medical schools? And after that, we've got a question that's come through.
Okay, so I think it's very I'm very optimistic on this. Actually, I've been in this field for about 25 years, and the whole environment is changing. As I said previously, the Brazilian Psychiatric Association, the American Psychiatric Association, the British, the Royal College of Psychiatrists, the World Psychiatric Association, all of them have recognized the importance of spirituality, so it has become more and more prevalent in the textbooks, in Congress, and also in medical training. And we are currently now, I think it's very interesting, we are now currently working in a collaborative project with John Petit, Professor John Petit from Harvard University. We are developing a curriculum on spirituality for training psychiatric residents. So we just published some papers about this new curriculum, and we are currently now conducting a study, implementing this curriculum in 12 different psychiatric resident programs to see the impact. So the idea is after this study, we would be able to scale up to more residence programs around the globe.
No, that's really good, encouraging to hear that. Thank you. And I believe we have a question for you. From Faye Waddington as, how could you ensure that upon asking a patient about their religious beliefs, your question does not carry any sort of bias or criticisms to any creed in particular?
Very good question, very good question. I think one of the major challenges that the clinicians face nowadays is that most of us nowadays recognize, acknowledge the importance of taking consideration spirituality, but we were not trained in how to do this. We were not trained in how to take a spiritual history properly. So because of that, we have developed some training programs, published books and lectures. But just to give a basic short answer, first we need to ask in a very general way, for example, do you have any spiritual or religious beliefs and practices? How do they impact your life, your coping skills and things like that? And even if you don't know about the religious tradition of the patient, we could have a genuine interest in learning that. We also need to have intellectual humility. We need to be humble and try to understand this and to have a deep respect for that. And of course, we need to work in our counter-transference. We need to work with in ourselves how, if we have some bias pro or against spirituality, to avoid imposing that. I think actually it works like any other set of values that the clinicians may have.
All right. Thank you for that. May I ask, we've got a couple of minutes left. Is there one more question we can ask? From Stefan Bertozzo, what is missing to have medicine and spirituality walking hand by hand? Thank you, Stefan.
Okay, very good question. Actually, I think it's becoming more and more correlated nowadays. I think what's actually missing is a kind of mindset. I think it's still prevalent, at least in the academic environment, a kind of mindset that I referred previously in my presentation about a kind of necessary conflict between spirituality and science, some myths, historical myths about this. Also the misguided idea that science has proved physicalism, materialism, that all sorts of spiritual ideas are superstition ideas, only people illiterate or sick would believe in or have such experience. Of course, this is not true, and the data is strong on that. So I think the major barrier nowadays is in some intellectual groups that still hold some ideological anti-spiritual perspective.
All right. Thank you very much for that most interesting talk. And I hope people have taken note of your contact addresses. Thank you very much, Dr. Alexander.
Thank you, Natalie. It's a great pleasure being here. And again, congratulations for all the Congress.
Okay. Thank you. Thank you. May I ask those of you who are here, would you register using the QR code in the corner of the screen, and then we can have your details to keep you updated for other courses. So do register. Now, we already have our next speaker waiting in the wings, and I'll just introduce her. This is Vanessa Anzalone. She's a neuroscientist and a psychologist, and she is the founder of the School of Emotion. She worked for 18 years at the University of Maryland. She's a fifth-generation spiritist and is the founder and former president of the Spiritist Society of Baltimore. She also founded and she worked with the Spiritist Group of Washington for 5 years. Vanessa is a Spiritist medium and has been translating and coordinating a team of translators of dozens of Spiritist books, among them Among Brother of Other Lands and Good News. She's also the co-author of the book The New Generation with Divaldo Franco and the editor-in-chief of the Spiritist magazine. Dr. Anzalone and her husband Carlos founded Kardec Radio, on which some of you are listening on your screens. She founded this in 2011. Vanessa Anzalone, would you like to add anything else to your introduction? Thank you.
Thank you, Natalie. Thank you, dear friends at the British Spiritist Medical Association. I don't have anything to add, but just to say, currently we're working at the Spiritist Society of Virginia, which is turning 14 years as well, here in the areas of Washington, D.C.
Thank you. And do you have slides for your
talk? Yes, should I share the screen? Can I? Yeah?
Yes, do.
All right, so I'm going to share the screen. So, dear friends, we are here in this conference all together, meditating, reflecting, studying what we're doing for health in the third millennium, right? That's the goal of the 8th British Congress on Medicine and Spirituality, at a very critical time, at a time in which a pandemic is still rolling in the world. And it's not only about the virus or the death, the illnesses, the lingering diseases, but also the mental health issues that have been escalating, from suicide rates to all different sorts of mental illnesses that have been impacted by it. When we go to PubMed at the National Library of Medicine and we research, we see that only in the last year, between 2020 to 21, we have already had several articles pointing out the direction that mental illnesses have been, mental health in general has been challenged due to the pandemic. And why we're talking about the pandemic, since we're going to talk about the physiology of mediumship, because we want to contextualize per the theme of this meeting, health for the third millennium. Right now, what's happening, this pandemic is redefining the directions for many of us, either healthcare providers or scientists. It's redefining the whole field of work and what's going to happen next, inevitably. And it won't be different when we study about mediumship. If we talk about mediumship, just as a curiosity, this is not profound research, but just out of curiosity, if you go to the National Library of Medicine today and you insert the word mediumship, you see that just the word mediumship will bring 55 citations from 1973 to 2021. In 2020 alone, we had a spike, an increase. 18% of all time citations happened in 2020, which is quite interesting. We were talking to friends and discussing this, and they said, well, probably because people were home, they were finally able to submit the papers, finish their manuscripts, and reviewers had more time to review it. That's why they got published. I don't know the answer to it, but we had to investigate further. But a sure thing that the word mediumship is already navigating in the fields of science. As the brilliant talk by Dr. Moreira just mentioned to us, there are groups of scientists who are more carefully dedicated to understanding the mind in its complexity, in its fullness, we would say. But it's not easy. In science, some questions that were raised here, it's not simple to go there and say, oh, let's research on this, because we're talking about funding, and funding depends on the push by society, and not necessarily this is in the main lines of our pipeline of concerns in our society. Not yet, though mental illness is a broad spectrum. Do we want to associate mediumship with mental illness? So let's check within these 55 citations from 1973 to 2021, the papers associate mediumship. They don't say that it is, but they are talking about mediumship regarding pathology of the mind, dissociation, consciousness, multiple personality, psychiatric disorders, spirit possession, trance processes, and even the relationship between mediumship and the brain. This is just a brief overview, because one thing we can tell, we are progressing, and more, and I'll go back to this graph to show to all of us that more and more we're seeing researchers dedicated and being funded to research on what concerns mediumship. We're going to talk about what we say mediumship is, but mediumship is already within the research of the medical field. Though still very confusing, it's not clear until we come to very lucid groups like the groups coordinated in Brazil by Dr. Moreira, Luchetti, and others. Dr. Andrew Newberg in the United States, who had a collaboration with Dr. Pires in Brazil as well, and they published papers. Dr. Gary Schwartz in the United States as well. As we are seeing the wonderful talk by Dr. Fenwick, giving us an overview about tangent topics as well. So we see groups in in England, for example, talking about tangent features related to mediumship that will connect to spirit attachment, as they say, in the beautiful Spirit Release Foundation in England. So we see that as the days go by, more and more scientists, more and more healthcare providers are paying attention to the inevitable, something that William James, the bright and wise, William James at Harvard, dedicated himself to for quite a while when he researched, for example, the mediumship of a renowned medium at the time, Leonore Piper. And his conclusions are in papers in the scientific community talking about the inevitable conclusion that it exists, though we still lack in science, material science, we still lack a true consensus on terminology, which is still being worked out, and the full understanding of it, and even the acceptance. The acceptance, we're still far from it, but we know that there are people who are working on understanding what we call mediumship. So William James himself named in his studies that there is a supernormal knowledge. You and I need more. When I work with patients, students at the School of Emotion, in my practice, I see daily the need for more. Yes, we want to work with evidence-based approaches, but there are new paradigms as well. Probably science have not adopted, but we would say scientists like Dr. Moreira, Dr. Paris, Dr. Newberg, Dr. Lucchetti, Dr. Schwartz, doctors in this field of spirituality and medicine have been adopting, and we can certainly reach out to those who are suffering the most. This is a medical spiritist meeting. We cannot lose sight of the fact that suffering is existent. And the first thing we need to do is to reach out. How so? So let's go to some of the studies just to show to us briefly. I'm not going to discuss these studies here, but here's a reference for us. A very important study that happened in 2012 by Drs. Julio Paris, Moreira, Caixeta Leão, in collaboration with Dr. Newberg in the United States, when they had this deep and very thorough study on mediums who are named psychographers. We say automatic writing just out of commonality here in terms of words, vocabulary. And they observed many interesting things. But when they did the neuroimaging during the trance state, one of the things that is interesting to observe, though not conclusive, is that they compared inexperienced psychographers, people who would write, and others who were under the trance state, what we call the experienced mediums, that they actually brought from Brazil and were under the framework of the educational framework of Spiritism. They observed that those experienced psychographers, they presented lower levels of activity in certain areas of the brain. Well, areas like the culmen, the left hippocampus, the occipital gyrus, the anterior cingulate cortex, the temporal gyrus, the presental gyrus, compared to normal writing, non-trance writing imaging. Well, what does that mean? Well, many things, and it's not conclusive. We cannot tell nowadays that there is a pathway, because we neuroscientists always look at aiming at, oh, is there a pathway, for example, in pain? There are pathways that modulate pain. We cannot say that there is a specific pathway, and we cannot conclude exactly the meaning of this lower activity in specific areas, but we can tell that, number one, which is very important, physiologically, it's changing the trance state of the mind during psychography is, let's say, producing changes in the activation of our brain, in our physiology. From a materialistic point of view, people could say, is the brain producing it? Are these areas producing it? Or from a non-extracorporeal perspective, a non-materialistic perspective, however we name it, is what the extracorporeal mind producing these effects in the brain, in the physiology? Science cannot answer this question. Can't. Science cannot say mediumship doesn't exist. Cannot say no to something that they haven't proved. But we know that in those trance states, these areas of the brain are differentially activated. We could go deeper into this study if we had time to go through the details of each area, but that's not the goal now. The goal is just to show that during that state, the physical body is in a different state as well. It seems second nature for us, but not quite, because it was the first time that it was presented scientifically. Another study that is quite interesting, and we have to recognize these Brazilian groups are ahead of the studies in spirituality, medicine, and specifically about mediumship. So Lucati's group here in this paper in 2018, just 3 years ago, shows to us a very interesting thing. They compared 20 female spiritist mediums with 20 female non-mediums, which were the control group. And besides many other things, they measured some physiological measures like hormonal levels, heart rate, vital signs in general. And they observed interesting things. For example, in the summary here, as you can see, just out of reference, because later, if you want, you can go there and read the full paper. But it shows to us that there were changes in these physiological measurements for the mediums compared to the baseline and compared to the control group. But interesting enough, they changed like an hour later after the trance state. This shows to us, besides many other things, of course, as they say, we need more studies to understand more, but it's so interesting to observe that what is happening to the mind is affecting the body. And as Dr. Moreira was presenting some papers to us, how it affects our mental health as well. So psychiatrically speaking, we're seeing the beauty of these studies showing to us that there is not only the correlation between the mind and body, which we already understand, but we want to see that there is a special state of the mind that we need to consider, and it's not pathological per se. And when it becomes pathological, psychopathological, we need to take different measures, but there is a state of normalcy, we would say, when such state is entered, the mediumistic one. And that's why inevitably you and I need to ask help from the Spiritist science, because this is somewhat where the material science stops, does not answer much more to our questions, and has little, very little, still very little to help in regard to the spectrum of what to do when it turns to psychopathological issues, and we need to reach out to these people. So Allan Kardec, undoubtedly a researcher, a scientist, in 1857, changed the way we think. Little by little, the international community is getting to know of Allan Kardec. At Kardec Radio alone, we have, in the first 7 years actually, of our programs, we have interviewed hundreds of researchers, scientists around the world who are concerned about these issues. And we have all the interviews in our SoundCloud list for you, if you want to go back and revisit, from Dr. Andrew Newberg to Jim Tucker to Gary Schwartz, who was the first one, all of them recognizing, without a doubt, Kardec is a genius, still at the vanguard of humanity's progress, especially when we talk about the understanding of the human mind. From this perspective, Kardec shows to us that mediumship is a natural faculty. In the first chapters of the Medium book, he lays out clear-cut. It's not anything extraordinary. It's a natural faculty to us, so natural that it's physical, it's organic, it passes from generation to generation. Yes, it is physical. Why? We won't understand mediumship until we understand its multidimensional process, which is an expression that we found in some of the papers that were put together, published by Dr. Alexander Moreira's group in the past. Multidimensional process that will count inevitably on the understanding that we have a spiritual body. As you can see in this picture, which is a beautiful drawing from a scene that is described in the book In the Realms of Mediumship, or In the Domains of Mediumship, by André Luiz, through Chico Xavier, we're going to see this medium here dressed in blue as her perispirit, we call it, emancipates, expands, and allows the communication from the spirit. It's the speaking mediumship, and you can see this case, an obsessor, and we call it an ill spirit, a mentally ill spirit, because we think mental illness is restricted to the brain, but in the Spiritist literature, we're going to find mental illness is something that happens in the spirit brain, in the brain of the spirit, because it comes from the mind, the mental body, affecting the whole physiology of this spiritual body that will be temporarily connected, perispirit by perispirit, with the medium spirit to bring about the communication. We are talking about the perispirit as the venue through which mediumship is possible to happen. In the book Mechanisms of Mediumship, or Mechanics of Mediumship, which was interestingly dictated, which is a phenomenon per se to be studied, 2 mediums, 1 spirit author, bringing without a different in style, chapter after chapter, a very comprehensive understanding of mediumship in ways that science would be puzzled to really see the depth of it all. Studied very deeply by scholars around the world, it tells us that on the behind the scenes of mediumship, there is the physiology of our thoughts. We need to understand how it happens. It all begins in the mind, and physiology of the thoughts here, André Luiz explains, it means the study of the interactions of these basic elements of thought with the surroundings. Meaning, thought is matter, electromagnetic matter, maybe not visible, tangible to the physical eyes, but it's possible to be absorbed mind to mind. We know the studies on telepathy, but we're talking about also mind to mind from an incarnate to discarnate point of view. And here we have Allan Kardec, also in the book Genesis, reminding us that we, as we think, we create forms, mental images that will be possibly seen by discarnates and connected, making connections. This mental matter, says Dr. André Luiz in the book Mechanisms of Mediumship, that it contains particles, mental corpuscles, and these formations based on different vibratory conditions than atoms in the body, they have positive and negative charges. So as we speak, as we think, we are forming, creating, co-creating images, living images, and this is a matter of health. Dr. Martin Seligman at Penn State University, the father of positive psychology, has been presenting to us compelling evidence that positive thinking, like Dr. Fenwick said this morning, there is compelling evidence that positive thinking leads to health. How much are we as mental health providers providing solid approaches to train or to counter condition the negative thinking into positive thinking when we want to help our patients? And if we go even further, prevention, we're talking about health. We're talking about health in the new millennium. We need to talk about prevention, not only remedying it. And prevention, when we talk about prevention, we're talking about the new generation, childhood. We're talking about schools providing new opportunities for students to prevent what inevitably may happen if we don't know how to think or how to feel. Thanks to the pandemic, several authors, from researchers to writing authors for children, have been providing new literature, and as Dr. Martin Seligman presents, new approaches to boosting in our children optimism as means to make resilient children enduring the hardships of life and preventing depression, anxiety, and other disorders. So now, as we talk about this mental matter, Dr. André Luiz explains to us that this mental matter is so subtle that it's the instrument of our will. Will is so powerful, and we recall here the renowned Viktor Frankl, when he himself showed to us that when we give a new direction to our lives, we boost our will, we change the way we think, the way we feel, we change our lives. So when we think, we create mental waves These mental waves will vitalize the centers of our soul. In non-spiritist terms, people say the chakras. In spiritism, we say vital centers. And it will vitalize us, giving us a tone of health or disease. And then we will produce mental interaction. Inevitably, we don't think alone. We're always connected. Just like our phones, if we put on the Wi-Fi, it's going to attempt to connect at all times. We have our human Wi-Fi on all the time because we have continuous thought and we don't stop thinking. When I ask somebody, what are you thinking? They say nothing. It's just because they are in lack of words, but we're constantly thinking something. We're constantly connected, producing mental waves that will allow mental interaction. And this is where illness or health may come true. As André Luiz explains to us, when we read a page, consult a book. In a certain conversation, or when our focus is directed to something. Let's recall here, this is pre-social media, so we could say when we are reading something on the internet, listening to something, chatting with somebody, we are in correlation, spontaneous correlation with minds that are thinking alike, that harmonize with us, he says, through mental loads that we accumulated and transmitting form of pictures and serial sparks. And you may be asked, Vanessa, what does this have to do with mediumship, right? Well, first and foremost, André Luiz proposes a model here for us. He says that there is a law of the mental field in which we are going to absorb what we're emitting. We're going to connect to minds that are alike. We're going to, at some point, either produce and enter constructive mental currents, which is ennobling and healthy, or the opposite, destructive ones, when the soul will externalize maladaptive and destructive mental waves, attracting equivalent content and often falling into obsessions, which leads us into mental illnesses. I like very much this word André Luiz used in 1958, maladaptive, because a century before him, Darwin used this very word, adaptation, to tell us about our emotions, how we express it, and how emotions can dictate at some point directions to accommodate us into the important adaptation for survival. So André Luiz is presenting to us that as we think, as we feel, we connect. As we connect with other minds, incarnated, discarnated, we may present ourselves a new state of health or illness. Thus, he concludes in his paradigm, the Spiritist paradigm, that at the end of the day, if this is so, we're all mediums. Why? Because at every step, we're reflectors of the forces that we absorb under our will by focusing on our mental energy. So here comes to a point where we think there are mediums who are experienced in terms of their practice. But who is not a medium? If I get the book in this thesis that he presents to us in the book Mechanisms of Mediumship, André Luiz, in a chapter named Obsession, which is chapter 24, in the first paragraph, he teases us into new understanding. He says, the study of obsession, together with mediumship, will lead us in greater ways to understanding almost the whole humanity on earth. Showing to us that when we are studying the human mind, mediumship is just a natural faculty in us that we nowadays do not study at large, do not educate, don't even know what to do with it. Right now on earth, it's just a choice. In regarding our intellectual intelligence, we send children to school hoping that they will be instructed. Not necessarily boosts that much that intelligence, because we know that our intelligence is much more complex than we imagine. But we're talking about the concept of our spiritual intelligence, which is still in the realm of our will. If we want to, we pay attention. If we don't want to, we don't. But according to the studies of the Spiritist science and the inevitable studies that are coming along through our current science on Earth, the terrestrial science, we can conclude that we need greater attention to the study of this faculty in all of us. Number one, because it affects our physical body. In the studies of André Luiz, we're going to find areas in the brain that are specifically activated and through which these faculties being modulated. The pineal gland is one of the main areas that is already assigned or pointed out by the Spiritist science. Right now, we don't have a conclusive pathway for mediumship. Also because mediumship is broad, is vast. There are many different types of mediumship. There are many different levels of mediumship, let's say this way, in terms of education, in terms of experience as well. So it's going to be hard for us to really observe in the near future. If people ask, what do we envision? Some people ask me, what do you envision? In the near future, we need first to create a consensus on terminology, types, to really understand possible pathways. But we know that the physical body physiologically responds to this state of mind, the altered state of mind that will lead us to mediumistic experiences. So at this point, we would say our main concern regarding health for the third millennium is continuing support for the researchers and the scientists that can do this research and are allowed in their countries and are being funded to go ahead and do it. But also, we think that healthcare providers need to be, as Dr. Alexander was pointing out, encouraged to understanding the compelling evidence that we already have at some point in boosting new health in patients by encouraging them to follow their spirituality, their spiritual practice. And we say this, whether they say it's a religion or spiritual practice, but we would encourage Dr. Harry Canning at Duke University. Is one of the leading authorities in the field. He has spoken at previous meetings in the United States, and he shows to us that we will provide greater not only assessment in terms of health, mental health, but also encourage greater recovery if we promote the spirituality that the patient has embraced. At this point, we want to highlight something that we have been observing through our practice at the School of Emotion with adults, teenagers, and children. And this is a paper that was published by Figueiredo's group in 2021, talking about mental health during the COVID pandemic, impacting especially children and teenagers, not only all of us adults, but impacting in terms of mental health. And they predict that if we do not take action right now, the long-term consequences possibly will be underdeveloped brain circuitry, obesity, substance abuse, lack of emotional processing, psychiatric disorders, suicidal thoughts. Some of it is already happening, but the pandemic's not over. And we still need measures to be taken to support the children, the teenagers, the healthcare providers, and the mental health workers into understanding how we can operate with this mind that needs to learn how to think, to connect well, and to be healthy. So we would conclude without actually concluding, because this is just a very brief, I recognize it's not comprehensive, it's just a brief teaser for us to show that we still need, besides the Spiritist movement that already educates mediumship, we need to understand the means and pathways to help people educate their thinking, their mediumistic abilities, which is connection, it's the human Wi-Fi, encourage spirituality because it certainly promotes health, and pathways through which we can help heal obsessions, which can derive from mental, mal-educated mediumship or non-educated mediumistic abilities, or not. So I'm going to stop here to possibly discuss with you, Natalie, and answer to some questions.
Okay. Thank you, Vanessa, for that most amazing talk covering those areas. I wondered if I can ask you, before the first question comes up, how would we create change in the teaching in the medical schools and the healthcare teaching establishments? How do we influence the deans of medical schools to accept this kind of thing? Because on the one hand, everything's in the scholars, but how does it get to the teaching profession?
Yeah, Natalie, I remember we were in a conference at the University of Maryland with researchers from Johns Hopkins in Baltimore, Maryland, and in the field of pain, just as out of an example, the field of pain, we were having this conference and we were discussing cases of patients in which chronic pain could no longer be treated in the traditional way. So we're discussing complementary medicine about it. And I remember one professor at Johns Hopkins, renowned professor, he looked at me and saying about acupuncture, he said, I'm not so sure if we have enough evidence that acupuncture works. So this is to show to us, Natalie, that the evidence is there, papers are there, but it depends on the openness of the faculty, the directors of programs who work on the curriculum to really step forward. But I see advancements that are clearly happening around the world. For example, here where I am at the University of Virginia, Jim Tucker and his group, they have since Dr. Stevenson, lots of scientific research saying there is what they named a diathematic element, an element that goes from one life to another, crosses over death, that comes true. They can't explain the mechanisms yet, but they say we have evidence that reincarnation exists. But then when I asked some of them, so what do you do with it when your patient comes? They say, I don't know. So even the researchers themselves, they are blocked. And that's where I think we need, the first step would be discussions. Bring conferences into, bring complementary medicine discussions within the program first. As a director of behavioral sciences, I was allowed to insert in the curriculum not straightforward spirituality, as we were talking about here, but things that were coming along tangent, things that are already brought by Dr. Benson at Harvard University and the group in complementary medicine there. But we need first to raise awareness, to create awareness on this. And then at some point, people will come along and see that it's inevitable that we have to embrace the evidence and take measures from their own. Of course, if we talk about time frame, it's going to take decades ahead of us, to say the least, which is worrisome because mental health cannot wait. And the psychiatric hospitals in Brazil that have already absorbed the spiritist approach, they have higher successful rates in treating patients with mental illnesses. Dr. Emma Bragdon here in the United States has been doing great works bringing physicians from around the world to visit the psychiatric hospitals in Brazil and even teaching them courses about it. So little by little, we're seeing people opening, but I say, Dr. Gary Schwartz once told me at Kardec Radio, he said, Vanessa, I can do this research because I'm already full professor and tenured, but you cannot because science is not going to allow it. And we still have a lot of impediments in terms of the heavy-duty research that in Brazil is already being allowed, thanks to the Spiritist movement and the openness. But around the world, we would say the strategy would be to bring conferences like this within the environment to raise awareness.
I think it's so important because there's such a disparity between, there's such an anger against psychiatry and psychologists, and we need to meet those people together. I mean, is there some way that Kardec Radio can have a role to play in that?
Yeah, thank you for the suggestion, Natalie. That's my homework. I'll think very carefully about it. I like your suggestion, yeah, on how we can do it through Kardec Radio as well. I agree. There is much work to be done. That's a sure thing, right?
Yes. No, that's right. I'm just wondering if there's questions that have come up through the chat that I haven't. Here we go. Here's one. Thank you, Arnoldo. What is the best science to study and be related to mediumship? Psychology, medicine, parapsychology, or do we need an interdisciplinary way to understand it better? This is your last question before the break.
All right. Thank you, Natalie. Thank you, Arnold, for this question. You know, when I think through this question, I would say, I can't sugarcoat it. I'm going to say, the Spiritist science is the best you have now. Why? Because it's very comprehensive. We have very thorough understanding. Just the book, Mechanics or Mechanisms of Mediumship by Andrea Lewis, is a thesis on it. So deep, so compelling in the realms of mediumship that we have enough just there to understand, study mediumship. I don't think medicine, psychology are there yet. They have things here and there, but nothing really solid.
No, I'm aware of that. Well, let's see what we can do. Thank you very much again.
Thank you.
For speaking. And there seems to be a question at the bottom. Dear Vanessa, how do you believe this awareness regarding mental health and spirituality can be brought to young adults themselves who rebel against notions of spirituality?
I will share something that I do in my practice. When I see, for example, a preteen coming, the father, the mother says, "Oh, Vanessa, he or she is experiencing some rebelliousness, etc. The grades are dropping, they're not able to sleep well." And then when we do an assessment, we observe, because I'm a medium too, I have to say, I'm a medium too. I may be scientist, psychologist, but I'm a medium. I can see the spirits, I can talk to the spirits too. So it's clear when I'm talking, I can see. What do? I don't tell the kid, of course not, because that's going to scare them away. But I can ask them. I like Socrates' method of questions. Ask them. Bring them little by little to surrender to the inevitable and logical way. We are not self-made. The force that created us, whether we name God, Allah, Jehovah, however it is, why are we here? So we little by little can ask them questions per the allowance of the parents, per the spiritual path. So at the School of Emotion, we ask people about their spiritual path, their religious embracing, and we encourage them to think about it as we go along, because our belief is going to dictate our decisions, and our decisions will create lots of emotions. So we can't treat our emotions without going to the root cause of it all. So I would say we need a patient approach, but it's possible.
Thank you. And there is one more question. This is the last one. This is the really last one.
Sure.
Vanessa, do you think that one of the difficulties to accept spirituality is because we're looking for a human God?
Stephen, thank you for this question. It's going to be my homework too. I'll think about it. I don't know the answer to that. It could be. But I would say one thing that I've been thinking about. I think it's because people have, they are lazy to think. We have a disease that is happening nowadays in our society. Everything is just a click away. So some people, they have a hard time thinking. I remember a colleague of mine, very bright. We were looking at the microscope. He turned to me and asked, "Vanessa, why do you believe these things?" I never told him, but people talk. And I never explained anything because it's none of my business. So I said, let me ask you a question. That's how I answered to him. Why do you work so hard? Why are you so bright in what you do if you think life's going to end? It doesn't make any sense to me. So that's the answer. We need to be willing to think, to reason. And that's why I think Kardec was the brightest of them all, because he was not afraid to bring together faith and reason, without which we cannot solve the problems of the human mind.
Yeah. Thank you. And while we've been talking in the chat, Edwin Bravo has said in Guatemala, in the Master of Geriatrics and Gerontology, he teaches the bio-psychosocial and spiritual aspects. So things are moving.
Yes.
Things are moving. All right. Thank you, Edwin. Now we're going to take a 5-minute break, 6-minute break, and hopefully we'll have some music, and then we'll have another speaker. I wonder who that could be. All right. Thank you.
Thank you.
Now I've heard there was a secret chord that David played and it pleased the Lord. But you don't really care for music, do ya? It goes like this: the fourth, the fifth, the minor falls, the major lifts, the baffled king composing hallelujah, 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 hallelujah. Your faith was strong, but you needed proof. You saw her bathing on the roof. Her beauty and the moonlight overthrew ya. She tied you to a kitchen chair. She broke your throne and she cut your hair. And from your lips she drew the hallelujah. Hallelujah, 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 hallelujah. I did my best, but it wasn't much. I couldn't feel, so I tried to touch. I told the truth, I didn't come to fool ya. And even though it all went wrong, I stand before the Lord of songs with nothing on my tongue but hallelujah. Yes, I stand. Hallelujah, 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 hallelujah.
I see trees of green, red roses too. I see them bloom for me and you. And I think to myself, what a wonderful world. I see skies of blue, clouds of white, the bright blessed day, the dark sacred night, and I think to myself, what a wonderful world. The colors of the rainbow, so pretty in the sky, are also on the faces of people going by. I see friends shaking hands, saying, "How do you do?" They really saying, "I love you." I hear babies crying, I watch them grow. They'll learn much more than I'll ever know. And I think to myself, what a wonderful world. Yes, I think to myself, what a wonderful world. Oh, yeah.
You are on mute, Elsa.
Too much care for not being noisy. So it's an honor for me to introduce our dear Natalie Taubert. Dr. Taubert is a wonderful friend, used to help a lot since 2018, our BSMA. Natalie is a medical anthropologist who specializes in social inclusion education for medical schools, hospitals, and universities. She offers staff training on spiritual and cultural perspectives for understanding health. Dr. Taubert has undertaken original fieldwork research in Sudan and India, and also in the UK, which the NHS and King's funds. She is an author for 4 books, including her latest teaching manual, Cultural Perspective on Mental Well-Being, Spiritual Interpretation of Symptoms in Medical Practice. Her webpage you can visit and see the articles and books is www.aethos.org.uk. Natalie, my friend, welcome. I pass over to you. Thank you.
Oh, thank you so much, Elsa, and thank you for inviting me to talk. I've really enjoyed everybody's conversations here. I should add that what does a medical anthropologist do? I look at what people really do for health alongside the Western ways of thinking. So that's what I'm coming up with in this talk today. All right, thank you. And I live in a part of London where the population, it's 29% white, whatever the word white means, and 71% ethnic minority. And so if we're just looking at a Western way of thinking, with the amount of cultural diversity that there is in the UK, it's just not good enough to use only Western ways of thinking. So the talk today, I'm going to look about spiritist assumptions of the virus in different cultures, because we've had so much information about the virus and so many different ways of thinking. And I'm going to look across different societies. Now, let me see if I can use the slide. It works. It's just magic, isn't it? Okay. So the kinds of things I'm looking at, I did research in India. I went 15 times or so, had 2 projects, one in Tamil Nadu and another in central India. And then I'm also going to look at case studies from South America and Africa and Asia. And I'll look at the question about the unquiet dead that people talk about and hungry ghosts and the different treatment strategies. So the kind of people that I'll be looking at today are psychiatrists, psychologists, clairvoyants, psychics, shamans, spirits of the dead, therapists, and anthropologists. So it's a bit of a mixture. And when I started working on this last year, I saw a couple of articles published in the journal Nama, New Approaches to Medicine and Health, which is published in India from Pondicherry. And they gave me a kind of starting point to look at people's relationship to the virus. And I wanted to explore how people believed spirits related to the virus and what was the relevance for hungry ghosts. And I wondered if a deeper understanding of spirits and hungry ghosts might help people to better understand issues around the illness and distress and death. And so before I look at hungry ghosts, I want to consider the writings of the mother in Pondicherry. She was the consort of Sri Aurobindo, and she was born in Paris to Egyptian and Turkish parents. And she was deeply clairvoyant and had clairvoyant insights around the world. I'm getting used to technology, so we may need to be patient with me. So the work that I did in India, I wrote the book Spiritual Psychiatries, and it was based on field work. I had interviews with patients, psychiatrists, philosophers and clairvoyants. And I looked at the way people used religion to look at mental distress, the perambulations they did around the temple and around the mosques. And I wanted to find out if there was any relevance in the spiritual, in the practices that they did. Was there any relevance for us in the Western world? And the mother, she visited Japan in 1919 after World War I, and it was at the time of an epidemic, like similar to the one we have now, and she saw a lot of panic, and it killed many people, and there was an atmosphere of constant fear. And she said people were seen walking about in the streets with a mask on the nose, a mask to purify the air they were breathing so that it might not be full of microbes of the illness. And that was in 2019. And while there, she fell under attack from the virus. And her psychic insight showed her, I saw clearly a being with part of the head cut off in a military uniform, or the remains of a military uniform, approaching me and suddenly flinging himself upon my chest. And she called on all her power to heal the illness. And she said, microbes are forces of disintegration. She said, I had understood that the illness originated from beings who had been thrown out of their bodies. I had seen this, she said, during the First Great War, towards its end, when people used to live in trenches and were killed by bombardment. They were in perfect health, altogether healthy, and in a second they were thrown out of their bodies, not conscious that they are dead. They did not know that they hadn't got a body anymore. This may be familiar to people who work as mediums or psychics. And when I was working in India, I met a psychiatrist who's still alive, Dr. Sumitra Basu, and he lives in Pondicherry, and he felt that the Western model of psychiatry was not appropriate for Indian beliefs about the nature of existence, because he said there was an underlying assumption in Western traditions that people were influenced only by postnatal experiences rather than by past lives or the planets or karma or parapsychological influences or supernatural influences. So he said Western psychiatry was not appropriate. And he's prepared articles in a book. I'm glad to hear about Dr. Alexander's book. This is a book that's coming out later this year, written by two psychiatrists, Sumitra Basu and Michael Miovic, and it's called Consciousness-Based Psychology, Integral Yoga and Transpersonal Growth in Sri Aurobindo's Worldview. And Dr. Basu suggests that the virus and bacteria are gateways through which hostile forces may invade individuals and populations. And he said there were interactions between epidemics, occult forces. And in 1919, the Spanish flu claimed 50 million lives globally. So I went to India as a medical anthropologist, and I used the data from where the countries that I visited and when I did research with migrant and refugee groups in the UK. And I used this to teach in the medical schools, to teach medical students to raise awareness of different ways of understanding health, particularly mental health, but also physical health. Dr. Basu said that there were occult forces behind COVID-19, behind the current pandemic that we're experiencing. And he had an experience last year when he was woken from sleep by an entity which seemed to be a vital force behind the pandemic, which gripped his arm tightly. And he began to feel that he was collapsing and his legs were being immobilized. And at that time, last year, he wanted to pray for help, but he realized that he couldn't. And then suddenly the vital force released him from its clasp, and then he could invoke grace. And from this experience, he understood that he'd been shown how people succumb in fear to COVID-19 even before any organic damage occurs. And I've got a picture here of licorice allsorts, in case anybody likes licorice allsorts. I use it because the explanations that we hold for illness and mental distress are like licorice allsorts. We choose whichever fits with our current beliefs, our current knowledge base. And I found there are always multiple narratives about health. And I've just given us a range of explanations about the causes of illness. So it can be biological, could be religious, everything explained by contact with a god or deity, or psychological, the experiences of past trauma, or spiritual, opening to the divine or other states of consciousness, or it can be spiritist, relating to supernatural beings or dark forces or psychic attack. So there's a range of explanations for illness. Now I'm shifting quickly from India to an example in South America. And the example I give here is Dr. Alberto Villoldo. He was a medical anthropologist. He studied in San Francisco State University, and he was a psychologist, and he observed shamanic healing practices in Amazon and the Andes. And he studied with shamans who mastered the journey beyond death, and with healers who treated the luminous energy field surrounding the body in order to prevent illness from physically manifesting. And he said, he wrote, shamanic healers don't distinguish cancer, diabetes, or heart disease in their cosmology. They see these conditions and many others as symptoms of a spiritual illness. And he said, there's no difference between being killed by a jaguar or being killed by a microbe. To Westerners, being killed by a microbe is an illness, whereas being eaten by a jaguar is an accident, pure bad luck. And he said the wisdom keepers know that they have to be in sacred relationship with jaguars and microbes alike, or else they'll both look at him as dinner. And the shamans there, they say the visible and invisible worlds are inextricably intertwined. Something that Vanessa said as mediumship is a natural faculty. And he said the shaman does not believe in a division between the body and the spirit, or between the visible world of form and the invisible world of energy. With One Spirit Medicine, we discover how to dance between the visible, physical world of the senses and the invisible world of spirit. And in Brazil, those of you may be familiar with the work of Dr. Emma Bragdon, who did research interviewing psychiatrists and shamans, and she illustrates the practice in her book, Spiritism and Mental Health. And also in South America, looking at the Colombia region, was a book written by an Australian anthropologist, Geraldo Reichel Dolmatov. And he said there, the concept of disease is closely related to environmental sustainability. So shamans are the healers. Sickness is a penalty which serves as a mechanism to enforce rules about ecology. Illness is seen as the ecologically inadequate behavior of the patient. And I'm wondering if we had that perspective in the West about what we're doing to the environment, would that seem relevant? So he said, sickness is a direct consequence of a person having upset the ecological balance, and he or she is said to have caused the disease. And it's also, the shamans don't operate at an individual level like the doctors and the healthcare professionals here. They work to assess which part of the ecosystem has been disturbed. And this concept around illness serves to establish rules to address overhunting, polluting the water, depletion of plants, and overpopulation. And I'm swiftly moving from South America to Africa and on to Asia. I just wanted to show that there's a commonality of this natural faculty that people have, that we've kind of ignored. People that haven't got the technology that we have in the West. This is a book was research done by British anthropologist Victor Turner. And when people became ill, he wrote, their first explanation was that ancestral spirits had been disturbed by their behavior. So sickness was also caused if a taboo was broken or by quarreling with kin. So during a public ritual to release a man from troubling ancestral beings, the participants spoke all his troubles aloud. I'm just wondering if this understanding of sickness and environment, we're taking that on now in the West. We're a bit behind with how these simpler societies in Africa and South America were. And then during a ceremony, it was acceptable for secret grudges and animosities to be spoken. So speaking private matters in public allowed the angry spirit which had caused the sickness a gateway to leave. And we're shifting from Africa to Tibet and the Tibetan Book of the Dead. There was a film done of that book called The Great Liberation. And it was a book showing a Buddhist Lama and his novice guiding a dying man into the afterlife. And they said 49 days of prayer to release the dead or dying person from their attachments in this life. And so they had 49 days of prayer. So they made sure that people didn't hang around in the earth's plane. And so there are some societies where they really acknowledge the role of ancestral spirits, the role of ecology and environment, and the unquiet dead. But I just wanted to look quickly at who are the unquiet dead? Who are the hungry ghosts? And in Japan, there's ghosts of the dead that can be found in graveyards or a place where death happened. And they tend to wear the same clothing as when they died. And they may haunt a place or a person, but they may be reluctant to accept their death and can bring misfortune on others. And books have been written about the unquiet dead. This one's by Dr. Edith Fiore. And she said, the unquiet dead can be spirits of people who die suddenly, who do not know they are dead. They may roam around on Earth's plane and may attach to the living, causing illness and mental distress. And then this concept of hungry ghosts, they're found from the Far East, the Philippines, to Japan, China, Thailand, Laos, Burma, India, and Pakistan. They're universally described as human wraiths-like wraiths with mummified skin, narrow withered limbs, grossly bulging stomachs, and long thin necks and tiny mouths. And they were hungry ghosts unable to take in or assimilate what they desperately needed. The problem lies in their constricted throats, which cannot open for nourishment, and so they wander aimlessly in search of relief that is not forthcoming. And hungry ghosts, they may be the wider collateral of war alongside human diseases. And there is a special month in China Vietnam, where the hungry ghosts come out and people lay food by the roadside for them as offering. So they're beings that are driven by intensely emotional needs. But they enter human space during the months of July. And this book, In the Realm of Hungry Ghosts, was written by physician Gabor Mate. And during the Second World War, his grandparents were killed by the Nazis. So he felt his parents' intense grief as a child. And he was aware people who had addictions had lived through great trauma, violence and loss. And writing about the book, Hungry Ghost Realm, and I don't think he mentioned spiritism, but it seems to be a similarity where the domain of addiction, where we're constantly seeking something outside ourselves to curb an insatiable yearning for relief or fulfillment. We don't know what we need, and so as long as we stay in the hungry ghost mode, we'll never know, and we haunt our lives without being fully present. And I wonder if practitioners see people with that kind of similarity. So I've got a couple of slides just on war and hungry ghosts. And my proposition is that war creates a wider collateral than soldiers, their victims, and any bereaved relatives. And spirits of people who die suddenly, who do not know they're dead, may roam around and may attach to the living, causing mental distress. And so in Pondicherry, the mother at Sri Aurobindo's ashram and the psychiatrist, Dr. Vasu, who also had psychic visions, she was informed that soldiers who were killed but didn't know they died were also the cause of virus illnesses. So living people may spontaneously access the trauma of earthbound entities, exacerbating any mental health problems. And I just wanted to finish by looking quickly at treatment strategies and what we can do and what's enough. So what can we do to address human distress? We've heard about lots of examples here on this Congress of practitioners, but I'm wondering what kind of treatment strategies are useful. And of course, it depends on people's belief about the causes of the virus. So obviously one strategy is vaccination and masks, and another one is perhaps to stop creating war, to stop creating spirits of beings who don't know they're dead, to stop othering other people or wanting their territory or environmental resources. And I just wondered, is it enough to consider psychology alone, or do we need more than believing it's something just in the head? Is it enough that we use one-to-one therapy, because that's a very Western strategy of healing? Or is it enough to assume that problems just come from thoughts in the head and not from any other kind of spiritist attachment? Is it enough to treat the body on its own or apply mechanistic solutions to illness and viruses? Or, for example, CBT, if it addresses thoughts as if they are the responsibility of the holder's mind and emotions, but they have nothing to do with a spiritist type thought intrusion. So we do need therapists who address negative thoughts and behaviors, but also practitioners who have the natural faculties and aware of spiritist perspectives. We do need both and, because otherwise we may have treatment that targets emotions or thought forms in the head when spirits can hook on to a person and create further distress. So we need both and. And the book by the two psychiatrists, by Dr. Sumitra Basu and Dr. Michael Miovic, they offer a fusion of traditional Indian knowledge about consciousness alongside Western understandings, and they identify key differences between Eastern and Western scholars. They cover issues around reincarnation, past lives, spirit possession, strategies for addressing hostile forces. And they tackle the kind of things which may make Eurocentric therapists uneasy. But I think we do need this material coming from psychiatrists. I'm told it'll be published later this year. And my question is it enough just to acknowledge the virus on its own? Is it enough just to use hand gel and masks and vaccinations and still sell weapons for mass killing of people? Or do we need to rethink our morality? My feeling is obviously we need multiple responses, and I think that's what we've heard from this Congress here. And it would be good, perhaps we could learn how to stop the violence or acknowledge the damage that war does to humans. And perhaps we need to offer prayers and offer and honor everybody that's incarnate and in spirit. So the treatment strategies that I think we've heard about today is prayer, intention, focus, working together as a group in order to promote healing and training to change the paradigm inside medical schools and hospital, to raise awareness that there's other ways of working. I have been teaching the last 15, 16 years to medical students, and they are much more aware these days that there's different ways of thinking. It's not the struggle like in the old days. So the times are changing. And this, it happens, is my last slide. So thank you. I hope I've kept to time, and thank you for listening.
Yes, you have kept beautifully to time, and what a wonderful talk. It really broadens one's horizon, makes one think that we must get out of our Western silo. We've actually got to think much wider than we are at the moment. Natalie, that was stunning. Now, who has some questions for Natalie? Are there any?
I did see a couple come up.
Yeah. Did you come across the use of plant medicines, ethogens, by shamans in your study? Interesting question. And what is your understanding of what this might offer us?
I didn't come across plant medicines. It happened, Jeanette, that in 1997, when I already had a doctorate in something or other, someone was giving a talk in ayahuasca at a conference. I was talking at it and I was chairing some session, and they were talking on ayahuasca, and I'd been doing all sorts of shamanic this and that, and I saw the spirit of the ayahuasca plant, and it smiled at me and it said, stop all your experiential work, register for medical anthropology, do another degree, and find a language to question the old system of healthcare. So that's my only experience, but I actually haven't taken ayahuasca. I don't drink alcohol or even tea and coffee very much, but I haven't encountered myself people who use that medicine. Thank you, Jeanette. And Joe Dot.
Natalie, do you think some of the distress might also be caused by animals who have died suddenly, not just humans? And this is exactly what we're doing with all our meat eating on this planet.
Oh, God, I've just had to mark an essay on that. In India, they have a theory that animals that are taken as pets are individualized and then reincarnate as humans next time round. And it may be that this kind of factory farming that we're doing, that it can influence us.
Okay, well, no, I think that's an interesting point, but don't forget that on the farms, the farmers, in fact, have a relationship with their animals, so it's a difficult one. And here we have question to Natalie. What about the illness of shamans? For part of psychiatric patients were shamans who ignore themselves. Yes. How to ground these energies? Nice one for you.
Yeah, thank you. Well, there was, in the old days, there was the thought that the shamans were really psychiatric patients, but they went through and they acknowledged that their skills. And I think there are groups of people now with spiritual awakening and spiritual crisis where they feel they've had problems and they may be shamans in waiting. But the problem comes if you open yourself to all your natural faculties, that you can be hypersensitive of the energies that are around. And it may be okay for a shaman to do that thing who's familiar, or a medium who's well controlled. It's just, I was told very clearly, Natalie, you're too sensitive. Don't mess with it. Stop doing all of that kind of work and go back to college. But I think there is a link.
Interesting. And you believe that, and it was obviously just right for you. Here's one from Stephen. Yeah. During your researches, which treatment makes more sense to you?
I think the question for me, Stefan, is it's a combination. It's always a combination. You need the psychology, the psychiatry. The psychiatrist in India, they believed that, or he believed that an illness, psychosis, was an event. It wasn't a disease of the brain for life. And so he did offer medication, but he reduced the dose. But he also offered prayer and rituals around the temple. So I think the question is, I don't know that there's a single treatment. I think it's a multiple. We need to work with a multiple of therapists and remedies. And I think the only people who can change the old-fashioned psychiatry is psychiatrists themselves.
Yes, it always goes back to the group, doesn't it? Thank you, Stephen, for that. And any other questions for Natalie? Well, in fact, we have a few minutes. Natalie, that was the most stunning talk, and you've obviously gone into this question of the relationship between the virus and mental health and physical health in the planet. Do you feel that there is a connection yourself, because you're a Westerner? We're brought up not to look quite so widely, although you, of course, in your training will do so.
I feel we need to look that widely. We need, I brought up those examples where illness was seen as the damaging behavior to the resources or the environment, because at some level I believe it. I think we're not we're using sticking plasters approach for the virus, but we're still selling arms to certain countries. We're still benefiting financially. And that doesn't make sense to me, that we should go round in masks, take vaccination and continue to sell bombs. It just doesn't fit with me. So, yeah, so I believe it.
Oh, I think that's so wise. I think the whole idea of exporting arms to other countries that they can kill themselves while we sit here protected with our atom bombs is absolutely crazy. Sonia, that was Natalie. That was an absolutely wonderful talk. Really enjoyed it, and thank you very much for giving it. And just to say how nice it is to have your thinking and your thought on the committee of the new BSMA. Thank you, Natalie.
Oh, thank you, Peter. That's very kind of you to say those things. And I did hear Casper in the background, Casper the cat. So I know he's present.
Yes. Casper is indeed present, and so he should be for a talk like yours. Thank you, Natalie. Okay, and now is Sonia here, because we're going to have a little chat together. Oh, there she's coming. Sonia, lovely to see you, and thank you for your introduction earlier on. What an amazing conference. Don't you think so?
Absolutely.
With a wonderful, wonderful description of mediumship by Tanya, Alexander with his very wide academic approach, and then Vanessa with her practical experience and also her scientific approach. And then Natalie took the rug from underneath all of us and pointed out that it was our bad behavior which did this. What are your feelings?
First of all, Dr. Fenwick, it's an honor to be here with you in the closing of this fantastic meeting. As you said, we had wonderful speakers, and we learned from the speakers that the benefits of integrating spirituality and religion into the conventional medical practice. And the key to all of this is the understanding of our spiritual nature and understanding our interaction with the spirit realm in a very natural way. And the other benefit of the spirituality and religion, I would say, complementary approach, is that it's free of charge, isn't it? So it's a good benefit.
It certainly is.
And also we heard about research, and we were so fortunate to have two prestigious research, Dr. Moreira Almeida and you, in this event, because research is the basis to bring up the benefits of spirituality, of religion, to health and well-being, demystifying all this and making it as a good connection so that our colleagues can see this approach, can acknowledge and respect the spirit nature of all of us. Don't you think?
Yeah, I think that's very important. In fact, this Congress was titled Health for the Third Millennium, and it's certainly done that. What is shown is what's required is a great expansion of our understanding and what religion brings. It's all the science now behind it. And also, we've been shown that if we don't change, then things can only get worse. So, I think the Congress is well named, and I think the speakers have done us proud in the papers that they've given. Sonia, how are we going to change this? Because after all, you are leading at the moment BUS, the British Union of Spiritual Societies, and we're one of your people in BUS. And so how, Sonia, are we going to make what we've learned today, which is in one sense just pure science, available to the medical profession as a whole?
It's a great question. First of all, I'm very, very happy that now we have, with the support of BUS, we have the British Spiritist Medical Association, because I think that, you know, as you said, the title of this event is kind of looking in the next era. And how are we going to promote this? And as I said, I think that events like this that are available, especially because now is online and everyone can join in, and we have people from all over the world in this event, I think that's the key to it, is that we present in a scientific basis the benefits of spirituality, of religion, to improving health and well-being. So without the label of formalized religion, because I think, Peter, I don't know if you agree with me, but I think our colleagues in medical practice especially are very afraid of getting into the labels of formal religion. So as we are presenting this as spirituality is a broad, it actually encompasses every religion, every non-formal religion, as Spiritism is a non-formal religion, and any belief that goes beyond the material world. So everyone can respect, can join in, and can use, because, you know, there are papers showing that spirituality and practices like meditation can even change expression of our genes. So this is, I think,
oh yes,
right? It's a profound demonstration, scientific demonstration, right? So I think that meetings like this that are open to our colleagues, and the more we attract our colleagues to meetings like this, the better it is, so that we are sharing experiences, we are sharing knowledge.
Yes, I'm sure that's absolutely right. I was just thinking of when I was a consultant, a practicing consultant several years ago, the thought that one of the consultants should pray with a patient was something which might almost be reported to the administrators of the hospital. So we've really got to start looking at what are the important factors in people's lives. And if prayer is important, then provide it. If an understanding of the multi-component part of one's nature determines a new and wider science, then let's go there. Because after all, what we are trying to do in the medical profession is to help people get better. Mm-hmm. And if helping them get better is just pointing them to themselves, that's fine.
I agree. I completely agree. And I think that researchers like you, like Dr. Koenig, like Dr. Christina Puhalski and Alexander Moreira Almeida are so important, because you're so well known in the world and so respected that people actually read and learn from your research, and that's so valuable. So I think those are the key for us to evolve into this area. So I really,
yes.
want to thank you for all the research that you're doing, and also to that your participation in these meetings is so important because people really respect you.
Yes, I think that it's very important to have good scientists, and I think that's exactly what we've done today. And what we've seen is that the old reductionist science really doesn't go nearly far enough. Yes, I remember I was coming away from a conference with a neurologist very high up in his field. We were talking about the brain and how it's constructed our reality. And he said, well, of course, you know, there's no such thing as free will, don't you? And I said, that's interesting. And what makes you say that? And he said, oh, because it's all constructed in the brain. We've got some papers showing that at least 10 seconds before you take a decision, the brain has decided what decision to take. And I said, do you ever go home and tell your wife that she has no free will? He said, that's quite a different matter. And it's sort of what the problem is, isn't it? On the one hand, we don't behave as if we're human when we're in the science lab at times. And what we need to do is to actually understand and honor our humanness.
That's right. And I think that, you know, as you said, we also need to pay more attention to other research that are coming out and showing that it's not just our material brain that produces everything. There's a consciousness there that actually resonates with our brain structures, and that is into our thinking, our acts, you know. So there's so much of science in that realm also that illustrates why we have such a complex nature. That is, we are not just a machine that is so predictable. We are not that predictable.
Yes, but as my little anecdote shows you, everybody knows this except the scientist working at his bench, and he knows it perfectly well too. So we're split like this, and I think this is the fault of our science, without any doubt. The Reformation was terrific, and the decision that we were, in fact, to look at Galileo's primary qualities only, which are things like mass, movement, etc. We're not to look at his secondary qualities, which are the qualia, the redness, the smell, the sense, the feeling. That's not for science. And we've kept with that. And so we've really lost a whole half of our nature, but that's our history. And the thing about history is it can be changed. And the Medical and Scientific Network, I don't know if you know of it, they have now the Galileo Commission, which is setting out deliberately to change the whole thrust of science to include the secondary qualities as well. And yeah, we've got to give it up. We've got to expand.
Absolutely.
So, have you any comments, being the overarching body of the British Spiritists, about today's conference? Are there any remarks that we can take home from you?
I think the main remarks is that we have highlighted the benefits of spirituality and medicine. We have highlighted the interaction as with the spirit realm, like Vanessa was talking about the mediumship and all, in a way that, and that's what we learned from Spiritist teachings, that there's no much mystic things. Everything is so natural. It's not something out of natural. It's a natural. We are in here now, embodied beings, but next minute we could be on the other side. And you have, worked so much on the deathbed that you know that, more than I do.
Indeed.
So,
Indeed.
so I think that this is the very important understanding of our spirit nature, and that this can contribute not only for us to be sick, as for us to improve our health. So the knowledge of our mind, the knowledge of our how we deal with our spiritual energy is key to that. So I'm really very happy that BSMA is now one of our new affiliates in the International Spiritist Medical Association, and that you guys there are going to be a source of knowledge for people around. So the more people we have, the better we'll be into promoting and preparing our next generation.
Yes. Well, thank you for that. And it's the title of the conference again, New Health for the Third Millennium. Absolutely. Well, Sonia, thank you so much.
Thank you.
What I'll do now is ask Elsa if she'll come, and then we'll say some final words about the conference.
Thank you, Dr. Peter. Thank you, our dear Sonia Doi, to be part in this Congress that we are interconnecting BSMA and international as well. You can say what you said.
Thank you, Elsa. Elsa, what I thought that we'd do is I'll give some closing remarks, then and introduce Sylvia, and then you can give the final closing remarks. So let me introduce Sylvia to you. Sylvia Gibbons, she's a member of our council. She's a counseling therapist, and she's the former director of the Chico Xavier Spiritist Society in London. She's also a translator of Spiritist articles, Portuguese into English. So we're very pleased to have her on our board, or on our committee. So my final comments are really what I've said to Sonia, an amazing meeting. I think, if I may say so, one of the most amazing meetings I've been to. There was one in Brazil with Koenig, which was an excellent one, because there we were learning about the relationship between religion and health in a very down-to-fact, matter-of-fact way. But here we have the wonderful experience of Tanya actually in the consulting room, and how she uses her spirituality there. Alexander, all of us know, and I've worked with Alexander for quite some time. Fantastic. Oh gosh, here comes Casper. Casper. Can you all put up with Casper? Because if I push him off the computer, he'll probably push the keys. Casper, come down. Oh well, he likes to make an entrance into these things. And I was talking about Alexander and how important his work has been, and then Vanessa and Natalie both giving us excellent views of Spiritist medicine. And Natalie's views were particularly wide, going right down to the shamanic feelings and what they notice about the relationship between viruses and death. I think that was fascinating. So I'd like to thank everybody who's taken part in this. I'd like to thank you all for coming here. And I'd like to thank Elsa very much for all the hard work she's put into it and everything she's done and kept us all in the right direction. So, Elsa, over to you.
Thank you. Thank you very much, Peter. So before the final, the ending of our Congress, I would like to show 4 slides here. I hope Adriano can, yes. As you know, this is our logo. All our Congresses will be the same logo, green and blue. And we would like to say thank you to all our speakers. That is next slide, yes. The ones that are organizing, working with us. We have the logos. That is a BSMA. That is International Medical Spiritist Association, Kardec Radio, Spiritist Academy, BAS. So together we did this event, one-day event to everybody. And also, thank you very much for our musicians, that they did a brilliant time, 2 hours time, beautifully singing, playing. So it's enchanted for all of us these moments. And also, our last one, thank you, all our dear friends, speakers. Together, we move the world. Alone, we can do almost nothing, but together, in spirituality and health, we can move the world toward progress. Thank you so much, each one of you, Dr. Peter, Tanya, Sonia, Vanessa, Alexander, and Natalie. We are working together. In 2 years' time, we will be together again. Thank you all for watching us, and God bless you all. See you next 2 years. Thank you. Thank you, Peter.
Yeah. And now we go to Sylvia for the closing prayer.
So, good afternoon, everyone. Just starting that it's been a wonderful day. There's so much learning, so much things for us to meditate on and to proceed forward with work. And it's just, grateful thanks for everyone that worked, to the speakers, the people in the background. And we thank everyone, and we thank God for this opportunity. And as we come now to close the work of our Congress today, we lift our thoughts to God in this moment of peace. One of the themes in our Congress this morning especially was forgiveness. The need that we have to forgive ourselves, to accept who we are and how we change and transform ourselves in something that we are really and truly within us. We are living through very difficult times, unprecedented times, and we have a virus that has been able to separate us from all those whom we love, from those that we care for, our family, our friends. And it has been a moment of isolation to many of us, and we can bear the isolation because we have love in our hearts, because we love those people, and we kept away from them to keep them safe, because we care not only our loved ones, but also to the strangers that we don't know. By our actions of taking care of ourselves, we are taking care of them. Because if there is one thing that this virus has taught us, is that we are all in the same place. We made of the same stuff, and it doesn't matter, it's irrelevant, the position that we have in the world. We are all affected. So in truth, what this virus, although cruel, has taught us is that we are all brothers and sisters, and we need to take care of ourselves and love one another. So we lift our thoughts to God at this moment, to ask Him for His peace upon us, for guidance, because we have learned that we are all well, or no one is well. So we continue with our love and taking care of one another for as long as it's necessary and forevermore, really. We ask for God for strength, for courage, for determination, that we may within ourselves get rid of the things that we don't like in ourselves, that we may look within and see, I don't need this anymore. I don't care about this, and I'm going to be a better person. And in this way, in accepting who we are and having kindness and forgiveness for ourselves, we are able to forgive others and to love others. Because Jesus said, love one another first of all. And that's what we need to learn. But before we learn ourselves, we have to learn to love ourselves, so we can have free love for everyone. We thank God for all the blessings we have received in our lives, and especially this day, with so much learning that has come to our hearts. And we pray, dear Lord, also as we are gathered together in this current of love and peace and harmony, we think of our world that's so divided. The heart of our world is so divided and so troubled and so unhappy. And there's so much fight and despair. So we send our thoughts of love and all this emotional feeling that we have with our hearts, that reach out to every heart in the world, that each and every person be connected now by love, by friendship, by peace, that we may build peace within ourselves and in the world. We are so grateful for so many blessings. And we imagine that there's peace in the world, that we all live in peace, and maybe one day everyone will join. It's like the words of John Lennon when he said, maybe you think I'm a dreamer, but I'm not the only one, and one day we'll be all living together. And we pray to God that be so sooner than we think maybe is possible. So once again, dear Lord, we thank you for your love, for your grace, for the opportunity of this work that is so enriched our lives today and will take us forward so we can start building another Congress, more work, more research, so we can unify in our love and in our hearts and in the peace for our planet, this beautiful, wonderful blue planet that God gave us. So may we learn to protect it, to love it as we love ourselves. May the peace of the Prince of Peace be upon each and every heart, today and forevermore. Amen.
Jesus, here I am, my knees on the floor, to say thank you, my Lord, for the lights that comes through this door. Your love is the key to change the entire world. Using these chains wisely. Will live in peace, in harmony. Now I understand, helping others is helping myself. Your words now are so crystal clear. Your teachings have no frontiers. To see all these transformations, we just have to put love in action. Now I understand, helping others is helping myself. Your words now are so crystal clear. Your teachings have no frontiers. To see all these transformations, you just have to put love in action.